بسم الله الرحمن الرحيم. الحمد لله رب العالمين حمدا كثيرا طيبا مباركا فيه، والصلاة والسلام على نبينا محمد وعلى آله وأصحابه ومن تبعهم بإحسان إلى يوم الدين وبعد. First of all, I'd like to apologize for the delay in making this video. I've had a tough 2 months. We had some relatives who became ill. I had a lot of appointments from patients, and I myself became ill with sihr, cabal sihr, devices and jinn networks. It was difficult, but alhamdulillah, Allah helped us with all of that. And the good thing which came out of all of this is that I was able to do the thorough Ruqya diagnosis of myself. So I got attacked about 7 times, I think it is. Alhamdulillah, I'm cured now. Alhamdulillah Rabbil Alameen. Like I said, the good thing about it was I was able to actually try out this new methodology where we do this thorough Ruqya diagnosis. And then you read the treatment intentions, and I was able to try all that out. You see, alhamdulillah. I've not been ill like that for 11 years, I think now. Yes, about 11 years. When I first got ill, I came up with what was known then as the 7 intentions. Well, alhamdulillah, by the rahmah of Allah, we've developed some new treatment intentions. We've improved those new intentions which I put out about 3 or 4 months back. Those intentions have been improved on, alhamdulillah. They're very good. I've tried them out and they definitely work. And that's one of the reasons I got attacked by the jinn, because I was doing these new things, you see. They didn't actually like, one of the things that they attacked me for was the very fact that I was teaching this thorough diagnosis. Because when I did the diagnosis, what's the reason for this attack? Well, one of the reasons was I shouldn't be teaching this thorough Ruqya diagnosis. They didn't want me to teach that. And teaching that question, oh Allah, have I extracted all the important information from my spiritual diseases? I mean, that diagnosis, they didn't want me to teach that. They didn't want me to teach the question, when you finish part 1 in the Ruqya treatment, part 1 of the Ruqya treatment, you do that diagnosis, oh Allah, show me if I've completed part 1 treatment. They didn't want me to teach that. So, and also the definition of a new spiritual disease, where it's anything that reacts to Ruqya. That's the new definition I go by now, alhamdulillah. And that's opened up a new world for us as well with regards to spiritual diseases, you see. And they didn't like that, so they were after me because of that as well. So yes, initially when we got ill, I was thinking, I got attacked, but it just, I was able, alhamdulillah Rabbil Alameen, to try out these things. I mean, there's nothing better than trying something out on yourself when you're in the field of Ruqya. Trying something out on yourself, doing it, and then it works, and then you can tell other people about it. I mean, there's nothing better than that, It's one of the reasons why I think Practical Self-Ruqya Part 1 was successful, those treatments and that, because the people see that, well, I've tried it, and when I'm telling patients, it does give them confidence. Yeah, I've tried it, brother, I've tried it, sister, it works. Try it, please, do this, it works. Alhamdulillah, Well, the same thing applies here now, with this thorough Ruqya diagnosis, it works, alhamdulillah. I did that, and then I was not able to get a clearance on past that diagnosis question. So when I did, until I got certain information about the disease I had. So Allah subhanahu wa ta'ala wanted me to know certain things about what they were doing, why they attacked me. So when I would do that, I diagnosed I had cabal sihr, had devices, some jinn were attached to these devices. They put some devices inside me. And when I did, oh Allah, show me if I've extracted all the important, I did some diagnosis, but then when I did the diagnosis, oh Allah, show me if I've extracted all the important information. I didn't get a reaction straight away. There'll be maybe 5 pieces of information, 6 pieces of information I had to get. And all of them were to do, I had one or two, obviously one of them there was to basically kill me, but the other things were to do with specific teaching points, which they didn't want me to do. That's why they were after me, you see. So I needed to know that, and it just proved that, alhamdulillah, what we're teaching is good. Alhamdulillah, it works. And they don't like it. If the very fact that they don't like it proves that it's good, alhamdulillah Rabbil Alameen. Yeah. Yeah, so doing a thorough Ruqya diagnosis, I benefited from it. SubhanAllah. When I did, when we go back to when I was first ill, I did a thorough diagnosis, but it was stretched out, it was long, and I didn't even know what I was doing back then. I knew I had to do a diagnosis to find, I just wanted to know who did this ahead of me and who's done this to me and who done that to me. I wanted to know those answers. I got all of those answers over a period of maybe, let me see now, maybe 5-6 years, But here I did it in not long at all. Maybe within half an hour, I had all of my answers. You see, whenever they would attack me again, I would find out within half an hour all of the things I needed to do. Then I would do the Ruqya treatment. Alhamdulillah, I would get cured. Alhamdulillah. So the intentions, that diagnosis, alhamdulillah, it's been fantastic, alhamdulillah. It changes a lot, basically. It changes a lot. Right. That new definition of a spiritual disease, which anything that reacts to Ruqya, that's opened up a whole different new world for us, alhamdulillah. You see, and we'll come to talk about that later on. When we're dealing with patients, and that's one of the reasons I think that's when this sort of attack sort of started. We were getting close to this number, which we've discovered, and that it looks like they've only got 24 categories of spiritual diseases. You see, and we worked them out by every time a patient would be. I had a particular patient who was getting attacked, and other patients as well. We would clear one particular disease and they will bring something else. So what's another one? And we'll do a diagnosis of, it shows we've extracted all the important information, and we won't get a reaction. And then, okay, is this a new spiritual disease, Ya Rabbi? And the person will get a reaction. Okay, is this a new category? And we reaction, and we will note that down. Okay, it's a new spiritual disease. And we've got up to 24. And it looks like it's 24. It's not gone further than that now. And one of the ways I know it's not more than 24, okay, through the diagnosis, because we've been checking patients, it's not been more than 24 when we get these, we've not come across any new spiritual diseases, okay? One of the reasons why we know it's 24 is that one of the reasons they attacked me is not to teach the 24. That specific number that's in the, it was part of the reason they attacked me. So they don't want me to teach 24 spiritual diseases categories. And I checked another patient and student, she got attacked, again, 24. I told her, look, check yourself if they're after you because you know about the 24 categories of spiritual diseases. And she reacted. See, that's okay. That's why you're being attacked as well. You see, and to top all of that off. So when I checked my Kabal Sihin, I think it was one of the devices they put inside me. It was there to give me waswas to not to teach the 24 categories of spiritual diseases. Very specific number. You see. Then one of the diseases I had a network that if I read Ruqya on it, it would release 24 spiritual diseases. The 24 spiritual diseases, subhanAllah. Yeah, so this is a real number for them, you see. And that's one of the reasons they came after me. Because they don't want this information out. Well, alhamdulillah, it's out now anyway, alhamdulillah. Yeah, so it's 24. We will talk about that more. Maybe we will talk about the new treatment intentions, which complement this new thorough diagnosis that I'm gonna do tonight, inshallah ta'ala. طيب. Right. Now we had one of my students got attacked by Iblis again, actually two. And patients and students, they got attacked by Iblis again. These are two sisters. SubhanAllah. So I think it's important for me to teach you tonight the intentions that you got to use against Iblis if he attacks you. Okay, so we haven't heard from him about 8, I think it was about 8 months. We didn't hear from him. Then one particular sister, she contacted me and she said, Said, I did some treatment on myself. And then one morning, I was in terrible pain, to the point that I thought I was going to die. And then she said she remembered something I said about if he goes inside you, Iblis goes inside you, you're going to temporarily goes inside you, you're going to feel like you feel like you're going to die, basically. And she said she felt like that, and she did a quick diagnosis, and she reacted to that. He was inside her. And then she said, I remember the intention side what you taught, burn Iblis as much as possible. As soon as I did that, he left, alhamdulillah. So I said, So she was very happy with that, you know, alhamdulillah rabbil alameen. We had another sister who had something directly from him as well, and also around at the same time, which was about 6-7 weeks ago. I then found out a sister, she's been attacked, so he's come back again. Okay, we haven't heard from him such a long time, you know. So I read on her, through her, and we burnt Iblis again. And since then, we've not heard from him again, alhamdulillah. So I think it's important for people to know about these intentions, because he might just come around now and again. He will go quiet for maybe a few months, then he will come back again and attack someone. And like I said, you will know that when he's attacking you, you will feel that pain. You will feel that pain, you know. So let us just look at those intentions. They'll be in the description, but let's look at them, inshallah ta'ala, because I think it's important to know them. Okay, so if you look at the treatment, so looking at where I say treatment intentions for Iblis. Okay, so they're in the description, video description, have a look at them. Burn Iblis as much as necessary. This is the big thing. Burn Iblis. We know the Quran, it burns them, okay? So burn Iblis as much as necessary. We can't say kill him because you're not going to die, but that is a key. That's the key here. Burn Iblis as much as necessary in all my 3 personal areas. And what we mean by the personal areas is fully inside your body. In fact, there are 4 areas, but let's just talk about the 3 first of all. Fully inside your body, completely inside your body. So it's completely inside your body, partially inside your body, and on your body's surface. These are the 3 areas the jinn sort of take up, okay? And that's how they sometimes avoid the ruqya. So Iblis himself might want to avoid the ruqya. As soon as you try to burn him, and you're thinking that he's fully inside you, he might be fully inside you, he'll move to partially inside you to avoid that ruqya, to avoid the intention. He can't really avoid the Quran, but what he's going to do is going to avoid the intention, you see. So he'll avoid that intention of fully inside, he'll just go partially inside you. And if ruqya hits him there, he might just go into your surface, basically. And that's what the jinn do, to avoid the ruqya, basically. So they're your 3 personal, they're the 3 personal areas. Fully inside you, partially inside you, and on your body surface. That's what they are, okay? And that's the intention number 1, which you would use if he possesses you, okay? If he possesses you. Now, doing that diagnosis, if you want to know if he's inside you, you read Surahs Nass, and you come to the last ayah, min al-jinnati wan nas, and you ask Allah subhanahu wa ta'ala, show me if I've got Iblis inside me, Ya Rabbi, you know? But like I said, it might be just too stressful for you to do a diagnosis, and you might just want to jump to treatment straight away, you know, because you'll feel it. You'll definitely know there is something strange happening. So you might just want to do the treatment afterward. Just do the treatment straight away and forget about the diagnosis, you know. Right. Number 2. Okay, this is the one I used on the sister. So the first one, the sister read on herself, and a brother read on himself when he possessed him temporarily. The number 2, this is the one you're going to read when he's in the networks outside of your body, and that's the 4th area. Outside of your body, meaning in those networks outside of your body, okay? So you read, burn Iblis as much as necessary in area 4. The area 4 is outside of your body, okay, in external networks. Via all external spiritual networks that I'm connected to me directly and indirectly. So he doesn't attack me, okay? That's the whole point of this. So those connections, you might have a direct line. The sister I read on, she had a direct line from Iblis, so he directly attacked her. Okay, he directly attacked her, you see. So I read on those lines coming off her body and going to Iblis, and there were other lines which were going maybe indirectly going to her. So I read on all of the lines. I asked Allah to burn Iblis through all of these lines, basically going back to him, or we should call them pathways, basically these pathways, network pathways going back to Iblis, you know. Doesn't matter which disease it is, sihr. I think it was sihr and kabal sihr. That's what she had. Their networks went back. But there might have been other networks as well, like waswas conditioning, jinn networks. They might have all gone back to him. So I just made a general intention that any network going back to him, burn him as much as necessary. And alhamdulillah, since then, we've not heard anything from him, you know. So these intentions, they do work, alhamdulillah. Imagine if we all did them. If all patients did this, you know. Just burn Iblis like this. All the patients who got sihr, because I'm sure all of the patients who've got sihr, they're somehow, some way connected to him. They've got some connection to him. You see, because he's involved in all of this. And if everybody burnt him, we wouldn't have maybe so many cases of sihr, really. You know. Yeah. So that's important. So I think memorize those. It's not very difficult to memorize, because if you're a patient of sihr and kabal sihr, you're going to need this. You know, you're going to need this, inshallah ta'ala. طيب. Right, for those who are not familiar with Ruqya, my Ruqya diagnosis methodology, then my advice to you would be to watch the read the self-diagnostic notes and watch videos 7.1 to 7.7 on my YouTube channel, and I think the links are also in my website as well. And watch Practical Self Ruqya Part 1 on YouTube, Practical Self Ruqya Part 1 video, and basically learn how to do diagnosis. And watch the Advanced Ruqya Diagnosis video as well. That would help, because that's what we're basically doing here, aren't we? We're doing sort of an advanced sort of Ruqya diagnosis here, you see. So, yeah, if you watch those things, that will give you a good background to how we do things. You might have to read the 7 rules of specific Ruqya if you want to do something that I won't teach here. For instance, you've got some diagnosis you want to do, which I've not really done here. Then my advice to you, to know if that diagnosis is permissible to do, have a read of those 7 rules of specific Ruqya. So you know that you're not doing anything strange with the Ruqya, you see. I mean, even today, I had some sister saying to me, oh, Said, she had her son is in a really bad state, and she knows it's a spiritual disease, and I know it's a spiritual disease as well, because we've had so many indications of it being a spiritual disease, you see, so many signs. And what she was saying is that I want to, is there any way I can sort of read on myself to diagnose him? And I said, no, you can't do that, sister. You've got to actually read on him directly. You can't read on yourself to find out what's wrong with him. That would be indirect diagnosis, and that would be wrong to do that, you see. And the proof of this is that the very fact that if you say to people like this, okay, if you found something wrong with him, how would you treat him? Would you read on yourself as well? No, it doesn't make sense. You won't read on yourself to treat somebody else. So if you can't read on yourself to treat yourself, then you can't do Ruqya diagnosis like that as well, you see. You know? Yeah. Right, now regarding the first Ruqya diagnosis, in that Practical Self Ruqya video, I do talk about using diagnostic water, and people use diagnostic water. Okay, and I remember the video shows me having bottles, and you're drinking the bottles, and you're reading and reacting. Now, some people, you might want to use that maybe for the first diagnosis, because sometimes it's difficult for the reactions to come up. And the reason you use diagnostic water is that it just makes the Ruqya reaction stronger, because you'll have Ruqya water in your stomach, and then you'll be reading the Ruqya yourself. So then you've got two sources of the Ruqya diagnosis. You see, you're reading, and you've got Ruqya diagnostic water in your stomach as well, so the reactions are stronger. That's the reason we do it. Yeah. So if for some people using the water, they might get reactions straight away, because we've had cases like that where people will just drink. They read for sihr, for instance, I talk about in that video. Just drink it once, and then they get a reaction from it. Most people are not going to react like that. Most people won't react like that. But some people do get major reactions with it, and that's clear. If you react like that, drinking a bit of water, and you start reacting like that, then it's clear that you got sihr. You see, there's no need to even do a diagnosis. It's clear there is sihr there. You see, because that's a clear reaction. You see. But not most people, that won't happen to most people. Most people are going to have to actually read the Ruqya diagnosis with it. And like I said, having that water inside you does make the Ruqya reaction stronger, you see. Some people have minor reactions, and again, they would need to read the Ruqya, read the Ruqya to confirm that they have something or not have something, or don't have that sihr, you see. Because sometimes it really can't really base something on a minor reaction. Major reaction, what we talk about major, I mean like that. So somebody definitely knows that it's that's, and it's something they recognize straight away as soon as they have that water. It happens. Some people say, oh, this is what he's talking about. This doesn't happen. We've seen it. It happens. I mean, these things, see, what it is, a lot of this is to do with experience. If you're not experiencing certain things, then you can't say anything, you see. So you can't say that's a bid'ah, or nobody can say that, oh, this is impossible to have. Because I remember there was some people saying things about this when I did those videos, saying, oh, this is strange. How can somebody say that you can get reactions? You can get reactions with water. It's possible. Somebody could drink. A few people, it can happen to them. They read Ruqya on the water and they drink it. If you don't believe it, fine. You don't believe it. But you can't say this is stupid, this is ridiculous, never happened before, this can't happen. It happens. My experience is different from your experience. You see, so like the same thing when I told some people that I removed the jinn out of my body, doing specific Ruqya diagnosis and removing the jinn out of my body. I did that. It worked for me. Oh, this can't be done. This can't be done. It worked for me. I don't know about what your experience is and not what your shuyukh experience, but for me it worked. You see, so yeah, it works. SubhanAllah. So what we will say to people is not to listen to some people, even whoever the person is, however many years of experience they had. If you're not, it's to do with experience. Some people have different experiences, and sometimes you find that some Raqi who's just been in the field for a year, he has some experience, and we can learn from that. You can learn from that experience. Only been in the field 1 year, he's done something, and we can learn use this. This seems to be really good to use this, or whatever, or some experience he had with something. You see. And because a lot of this is to do with experience. A lot of this field of Ruqya is to do with experience. You see. Okay, so that's the issue of diagnostic walk. But we're not going to talk about when you your initial diagnosis. Do it. So if you've never done any Ruqya diagnosis before, then I would advise you maybe to use the Ruqya water for the sihr, for those 4, like I do in Practical Self Ruqya Part 1. Just initially to understand the Ruqya reactions, to help you get reactions. You see. Like I said, because there'll be 2 sources of the reactions. It'll be you reading yourself and the water in your stomach as well, so that you get stronger reactions. You see. But afterwards, then you just go to just doing the Ruqya without the diagnostic water. Okay. Right. Yeah, just to reiterate that point, most people are not going to feel anything with the Ruqya diagnostic water. But, so they're going to have to read the Ruqya anyway. So don't just sit there when you drink it thinking, oh, I'm waiting for the reaction to happen. You might not get that big reaction. It's only going to be a few people. Most people are going to have to read. You read. So when you do take the Ruqya diagnostic water, you're going to have to read the Ruqya. So you're looking for sihr, you're going to have to read the ayah in Surah Falaq, ayah number 4. You're going to have to keep repeating it. Yes, you've read it in the water, you've drunk the water now you have to keep repeating that ayah to make sure that you've got reactions, you see. Dave, okay, so what we've found out from doing this thorough Ruqya diagnosis is that there's been so far no need to find a ta'weez. The ta'weez, we've had no need to do that. Although you can do that, there's nothing wrong with that. I did that, with certain patients, and I did it on myself. But what we found from here, it's not one of the things Allah wanted us to know. So when we ask Allah subhanahu wa ta'ala, Allah shows we've extracted all the important information, and there is some things we have to find out. One of the things so far, it's not been to find a ta'weez. Maybe in the future it might be. But the patients I've dealt with so far, even in my case, recent case, didn't have to do this, We didn't even have to look for sihr objects. Things which, when you touch them, the sihr goes on you. So far, that's not been the case. Also, finding the jinn in the body. There's no need really to find where the jinn in the body is, you see. So, but these things could change, and other people might have different things, you see, which it might be important for them to know, you see. For instance, there might be some sihr object in some particular house where the person keeps touching and he keeps getting sihr, keeps touching. So maybe that the person would probably have to find that. That probably be part of the, Allah show us if we've extracted all the information. That the person might need to find that out. You see, that might be the thing the person needs to find out. You see, but so far, no ta'weez, no sihr objects, no jinn, no finding any jinn really. We didn't have to do that. You see, Okay, let's move on to definitions. Then this is important. We had today, someone didn't understand the difference between ayn and just thought it's all the same. And I said, no, now we know there are 3 types of ayn. You've got the ayn, muta'ajjib, the ayn of the evil eye of amazement. Then you've got hasad, or the evil eye of envy. And you've got this, what I call Kabal Ain, the evil Ain, which is Kabal Ain, which is like the Ain of the evil elite, where they just give you Ain with without having feeling any jealousy towards your envy, or not even being amazed at you. They just give it to you just like that, you know. So it's important to understand the definitions. One of the important definitions to understand when we're doing this thorough ruqya diagnosis is the difference between the sahir and the one who goes to the sahir. People get confused about this, you see. They also get confused about the very fact that the jinn can give them sihr as well. You have to understand the jinn themselves can give you sihr. Just like a human can give you sihr, the jinn can give you sihr as well. So you'll have a jinn which is a sahir doing jinni, which is a sahir which is giving you sihr. You see, just like you get a human, female, male, giving you sihr, doing sihr on you, you can have a jinni doing that to you as well. Some people get confused between the sahir himself and the one who went to the sahir. The one who went to the sahir is paying someone to do sihr, pays the sahir to do sihr on you. Okay, so there's a difference between we don't call them both the sahir. You see, so there's a distinction between them. You need to know that when you're doing the diagnosis, you're going to get confused results. You see, your definition is going to be different. You know, you've got to understand what you're looking for. The sahid is the one who talks to the jinn, does those acts of worship for the jinn, worships the jinn, and then the jinn say to him in the end, okay, what do you want to do? So I want to do sihr, I want to learn how to do sihr. They teach him and he does sihr. So he's the one who's done all the acts of kufr and shirk to basically get the jinn to work for him, you know, or him working for the jinn. Maybe that's more appropriate to say that, basically, you see. So don't get confused on that point, because people get mixed results. I had someone who said that, I think this person got confused about who the sahid was. He didn't understand what sahid is, so he thinks all of them are sahids. The one who goes to the sahid, the one who is the sahid himself, and the jinn as well. So he ended up saying, you know what, I got 30 sahids who've done sihr on me. And they said, no, you got a bit confused here, brother. You see, what you want is you got to work out who the one who started it all off on you, the main person who's done the sihr on you. That's what you want to work out. You see, that's the sahir. Don't get confused about that, because you're gonna find out. And he didn't differentiate between the human sahir and the jinn which are sahirs as well. So he got confused. So they had a large number. You see, once I did the diagnosis on him, and I'll show you how I do that diagnosis, it all ended up being one person. It was just one human sahir who did it on him, and this number, well, I don't know where he got this number from. I don't think maybe it wasn't 30, but it was in the teens, 17, something like that, 12, 15, something like this, you know. So yeah, and I'll show you how I did that, inshallah ta'ala. Bismillah. Right. Yeah, so if you're going to read on someone to do a thorough ruqya diagnosis, what you need to do, you need to make sure that the patient has the same intention as you. You see? So the way to get around this, because you don't want them to tell them what you're exactly doing, because you don't want them, when you're doing that diagnosis where you're trying to find out who the sahid is, you don't want them to know that you're reading for the person's uncle or aunt or whatever it is. You don't want them to know these things. It causes maybe some interference, you see. So what you need to do, you just need to tell the patient, okay, look, just make the intention, oh Allah, show us whatever brother Saeed is reading for us. Whatever brother Saeed is reading, show it to us if I've got that thing. That's all they got to do. So whatever so-and-so is reading for me, Ya Rabbi, show it to us if I've got it. That's what the intention should be. You see, so it's not really specifically anything, but it's whatever the Raqi is reading for me, show it to, give us the reactions of if I've got that thing, if I've got that disease, and keep it like that. And you just you tell the patient to just keep saying, having that same intention. Oh Allah, show me whatever the Raqi is reading for, show it to us if I've got that. Basically, that's what the intention is. You see, so they continuously they keep making that same intention. There's no need. When even if you tell them what you're doing, you see, you just tell them, look, you just stick to that intention, okay? Because your definition, their definition might be a little bit different as well. You see, so and they might have that problem of who the sahid is and this and the one going to this sahid. That might be confusing for them. So, or they might be confused. They might not understand that point. So then, what you make sure you do, you tell them, look, just keep having this. This is your intention and consistent. I want you to keep having that same intention throughout the Ruqya diagnosis that we're doing. You see. And the reason why you got to have that is because we know from experience is that if the person's reading for having an intention for something else, so you're reading for sihr and they're reading for hasad and they're listening for hasad like that, it changes the diagnosis. It might have an effect on the diagnosis. How do we know this? From experience. We know that when some people, they listen to Quran and it's Quran which has got nothing to do with Ruqya. Like I think one of the for instance, one of the old I think it's Manshawi rahimullah or Ali Jabir, one of the rahimullah, I think one of them, they didn't do an audio which is to do with one of those qadis. They didn't do audio for Ruqya, and it's just reading Quran, you know, and you can listen to it obviously. But what happens when you listen to it with the intention of Ruqya? Now it changes. The person starts getting reactions. Initially they're not getting any reactions. They're just listening to it. It's normal because it's not Ruqya. They're not made the intention. But once they've made the intention to Ruqya, and listening is basically an action, so it changes now, and then they start having some reactions to the Quran, you know, which they previously didn't have reactions. Now they're having reactions. So likewise, when you're doing Ruqya on patients, you've got to tell them to have the correct intention. If they're thinking of something else, you're reading for sihr, and they're thinking of hasad, well, you're going to get a clash here, you know. It's not going to work. There's going to be interference here. You see, yes, your Ruqya might be overwhelming, and it might you know, basically take over, you know, because you're reading and they're just listening. However, that might reduce the effectiveness of your diagnosis because they're thinking of hasad. You see, they're thinking of hasad, and you're reading for sihr. You see, so just make sure that patient just has consistently the same intention, which is, oh Allah, whatever the Raqi is reading for me, on me, show it to us if I've got that spiritual disease, basically. Tayyib. Right, the next point. Before we go on to the diagnosis and going through some particular cases and that, before we do that, we need to talk about the reference point. Before, this is an important point. What we noticed with one particular patient is that he would get reactions at the reference point. And the reason why he was getting those reactions is because he already had made the intention, you see. So I told him what the intention. Oh, brother, look, just make the intention. Whatever Brother Saeed is reading for me, show it to us. So he took that intention on, and he took it on, and then basically sitting there and said, I'm already erecting, man. And I said, all I've done is just made the intention. Okay, well, you know what? I said to him, look, forget the intention. Don't do the intention. Just set the reference point up first of all, bro. Just do the intention. Just set the intention. So he did that, and that worked out much better, alhamdulillah. So my advice to the patients is to, before you do the intent Ruqya, take on the Ruqya diagnosis intention, set your reference point. So you don't have any you're not made your intention for diagnosis. You're just setting the reference point. So you sit there relaxed, 3 minutes, 4 minutes, even 5 minutes, and get your reference point. Then make the intention. Okay. Then you make the intention. And then just before you tell the Raqi that you're ready. So when you set your intention up, you get ready. You don't make your intention yet. You're setting up the your reference point. So you wait there maybe 2-3 minutes, and then when you're ready, just before you tell the Raqi, or after you've even told the Raqi, okay, brother, yeah, I'm ready now. You can start now. Now you make your intention, and then the Ruqya starts. You see. The Raqi will start the Ruqya, you see. That's what we need to do. We found that to be much better, and get rid of any interference, you see. You know, because some reactions are subtle, you know, and if some reactions are subtle, and if you have that interference at the reference point, it might confuse patients, you know, and even the Raqi, you know. Right. Let's look at look at the diagnosis, what you need to do. Generally, this is what I generally do with patients. I look for sihr. So I do sihr, and then I do is all of the sihr first of all from humans. Okay? So I do sihr diagnosis, general sihr diagnosis. So let me repeat that. First of all, I do is, has the patient got any sihr? Any sihr, Ya Rabbi? Show if there's a patient got any sihr. I mean, from jinn or humans, as the magicians, and I read. They give us a reaction. Okay, we've got sihr there. Could be from humans, could be from jinn. We don't know. Then the next one I do is, Allah shows if all of the sihr is from humans, magicians basically. We get a reaction. Okay, then all of the sihr the patient has is from humans. So then I move on to the next one. And then what I do next, okay, Allah shows if all of the sihr is just from one human sahid, and I read with that intention, and then I usually get, and the patients usually give me a reaction for this, you see. And then from there, then I talk to the patient, okay, who do you suspect? They maybe give me 4 names. Okay, then I put all the 4 names down, and sometimes they just give me the initials because they don't want to expose who these people are. So I'll have Mr. T, Mr. A, Mr. S, Mrs. T, and then I will read. Allah shows if one of any of these are the sahir. Do we have sihr from any of these? And then the person will react. So I say, okay, it is one of these 4 people. We don't know which one though. I won't tell them the name. Then I'll just pick one name and then I'll just go for that. So Allah shows if we've got any sihr from Mrs. T. And then if that doesn't work, then we go for somebody else. So that's what I basically do. And I do that for the other things as well. I do that for the Kabal sihr as well. Same thing. So we ask Allah, has the patient got Kabal sihr? Has the patient got any Kabal sihr from jinn and from humans? They get a reaction. Okay, Allah shows if all of the Kabal sihr from humans. They give us a reaction. Sometimes it's not. Sometimes we'll have to find out the Kabal sihr is actually from the jinn. And sometimes it's actually from Iblis as well. You see, it's from Iblis. You see, he's involved, you see. And why that is that the sahir, he's done some crazy ibadah for the jinns, or done some crazy shirk, and it pleased Iblis, and he comes himself personally does the sihr on the person for that sahir, you see. So likewise, so we do Kabal. Allah shows the patient's got Kabal sihr from jinn or humans, reaction. Then I would do Allah shows if all the Kabal sihr is from humans, get a reaction. Then I would do Allah shows if all the Kabal sihr is from one human sahir, and we get a reaction. And then what usually happens is the one who's actually done the sihr is the one who's done the Kabal sihr as well. That happens a lot of times. I've done it. It's been like that. The thorough diagnosis has been like that. Okay. Do the same thing for hasad. Allah shows the patient's got hasad from jinn or humans. General reactions, we get reactions. Okay, Allah shows if all the hasad is from humans, we get a reaction. Allah shows if all of the hasad is just for one person, we get a reaction, and then we work out who that person is. And you do the same thing for ayn, and then you do the same thing for kabal ayn as well. So we'll see from the examples I will read out. Inshallah, there's nothing better than actually reading out true, real cases, Inshallah ta'ala. But just doing that, sihr, kabal, saying who's done the sihr, and who's done the sihr, who's done the kabal sihr, who's done the hasad, and who's done the ayn, and who's done the kabal ayn and the ayn. Those 5, sometimes that's just enough for to pass the question, or get through the question. While it shows we've extracted all the important information from the patient's spiritual diseases, and the patient might give you a reaction, and then the patient can start treatment. Alhamdulillah, you see. Yeah. So sometimes you just need to just focus on those 5 and just knowing who the perpetrators are, and that's it. That's all you need to do. Right. This is something new we discovered recently, which we've used, which is really important. We were dealing with some particular case where the jinn was shape-shifting a lot, moving around, changing shape, changing colour to avoid the ruqya, you see. And what it was, we didn't know what to do because the jinns are just moving around, shape-shifting and stuff. So we said, okay, what we're going to do in this situation here, these jinns. And they were doing that to avoid the ruqya. That's how they avoid ruqya. See, what we realized when I was dealing with these cases in these 2 months, the whole methodology or the whole way of dealing with ruqya for these jinn, okay, is to shape-shift and move around to avoid the intention, you see. You know, like I discussed in one of the other videos, why they're fully inside you. Well, what they do next is they just partially go inside you then to avoid the ruqya, because they know that you're going to read with, thinking that, ruqya, I'm fully possessed, the jinn are fully inside me. No, they're not fully inside you. They're half in, half out. So they know now, the ruqya is not going to hit me. So they're doing all of these sort of things to avoid the ruqya, you see, turning into different things, animals and things like this to avoid the ruqya. Because the the ruqya, and it was successful in the sense that the ruqya wasn't hitting them, you see. So we would come across the case where we're dealing with the case and the jinn not getting hit by the ruqya. So what's happened here? The ruqya was hitting them. Now what's happened now? Because they've changed shape, or they've become a different. They've shift. They've become a hybrid, and they've become different. A different disease. You see, jinns jumping from one thing to the next thing. It was. They were doing a lot. So in order to deal with that situation, alhamdulillah, Allah guided us to something which was really fantastic, alhamdulillah. And that was what we call the freeze ruqya. Freeze ruqya in the sense that it's just ask Allah, let's freeze these jinns, stop them moving around and stop the spirit, and they would change the spiritual diseases around as well to avoid the ruqya. Move the spiritual disease from here, from there to avoid the ruqya. So what we came up with was how to solve this problem. We just asked Allah subhanahu wa ta'ala, freeze them basically, so they can't move, they can't function properly, they can't hear, they get blind, they're blinded basically, they're deaf, they can't communicate, no verbal communication, even the spiritual diseases as well stopped, so they can't move the spiritual diseases as well and change around and play around with it as well to avoid the ruqya. All of this is to avoid the ruqya, you see. So let me teach you this important intention before you actually do the diagnosis. And what we found is when I used it, when I recently got attacked, the first 2-3 times I got attacked, I had to read the ruqya for about 5 minutes, and then I would get reactions. So I knew that, hey, I think there is something there because I'm getting strange response. Let me read. So I really had to read 5 minutes, and then, or let's say 3 minutes plus, 2 to 3 minutes plus, okay. And then I would get reactions. It wasn't straight away like when I first had my illness. Oh, subhanAllah, I would read within maybe 10 seconds or 5 seconds, I would start reacting, you see. But not this one. I had to read longer, you see. I had to read longer because there's no jinn inside me. The jinn weren't going inside me, you see. So what I found was, when I actually did the freeze ruqya first of all, froze them, then I got reactions it was much quicker. The reactions were much quicker, alhamdulillah. I didn't have to wait for 5 minutes or, plus 3 minutes plus. Within 30 seconds, or maybe it might have even been 20 seconds, 15 seconds, I got reactions, alhamdulillah. So that's one of the benefits of freezing. And I think it's important before you actually do a diagnosis to freeze these things. Freeze them so they can't move around. Jinns can't do anything. And the funny thing is, we found that the jinn hated the freeze more than the kill ruqya. Because the kill ruqya, they could avoid it. They can do certain things, move around, do certain, change their shape and stuff like that to avoid the ruqya. We're not in the networks anymore. We're outside the networks. We can't get us now. We're out of their definition. So they're avoiding our definition because they're reading the patient's mind. What's the definition of the networks for the patient? No, networks is what's its name? It's on the surface. She doesn't include the surface of the body. So what the jinns will do? Okay, let's go. I had one patient. Her definitions of on the body or the surface of the body just meant the skin. It just meant the skin. That's what she understood when I used to tell her that it means this. And what did the jinn do? They go on her nails. Because when I did the diagnosis on her, I said, okay, what's happened here? We've got something different here. Says, okay, wait, let me just check you for something. Is that what your definition was, sister? Yes, okay, let me do it. So I did a diagnosis and we find that all of the jinn have gone onto her nails. Because she didn't see this as on the body, basically. You see? Because the jinns are reading the mind, you see, and they know what's going on. Okay, we're not going to get burned, and they can actually see things. So I'm guessing this, but I think what they actually see, they'll look and they'll see jinns burning on the surface of the skin, and they'll see maybe the area of the nails, nothing happening over there. So they will jump over there. The jinn, maybe they'll see 1 or 2 jinns on the nail, Oh, well, look at he's all right over there, isn't he? Let's all go over there then. So they all jump over there and they get saved from the Ruqya, you see, the burner of the Ruqya, you see. So that's what they do to avoid the Ruqya. And so shape-shifting and moving around, that's what they do. So kill Ruqya, when you hit them with the kill Ruqya, they can move around and do something to avoid it. But when you hit them with the freeze, they're frozen there. Now the kill Ruqya can hit them, you know. And that's one of the reasons that they were after me as well, not to teach this. From what I remember, not to teach the freeze Ruqya. They didn't like that freeze Ruqya. They didn't tell me nothing about kill Ruqya. No, they didn't say anything about the freeze Ruqya. You know, I'm quite sure there was something about one of the reasons that they not to teach, prevent me from teaching the freeze Ruqya, which I'm going to actually teach you right now. So we go against their waswas, and that's what you're supposed to do. Whenever they try to make you do something, you do the opposite. You don't listen to them. You know. So if you look up, if you look on the description of the video, you'll see the freeze intention there, inshallah ta'ala. Yeah. Okay. So let's look at this freeze intention. So this is going to be the pre-diagnostic freeze. There are actually freeze intentions during the treatment, which will show the new treatment intention. We'll put that in there as well. But this is what we've got here for the pre-diagnosis, you know, pre-diagnostic freeze. So before you do diagnosis, my suggestion would be to freeze everything in there so it stays where it is. Jinns don't move around, change things around and stuff like this to avoid certain things, you see. And you get Ruqya reactions much quicker, you see, because the jinns are not moving around, jumping around, trying to do this, do that, moving around to avoid the Ruqya. You hit them with the Ruqya, subhanAllah, the Ruqya gets them straight away. Dave, so yeah, we say here pre-diagnostic freeze Ruqya. Freeze, it applies to all 4 areas and all 24 SDs. Okay, so what we say, the 24 meaning the 24 categories of SDs that we discovered. Now I will talk about those in the what's his name in the next video, inshallah ta'ala, when we talk about treatment. If you're unsure about this 24, we don't really mean by the 24, then you could just have anything that reacts to Ruqya. Okay, anything that reacts to it. I'm quite certain about this number because they attacked me for it. I know that they attacked me for it. But if you're unsure about it, we'll talk about that another time. You could just go by anything that reacts to Ruqya. Okay, in all 4 areas and regarding anything that reacts to Ruqya. That's what the and that's another thing they're after me for as well. That definition of a spiritual disease. You see, the 4 areas as we discussed earlier is inside your body, partially inside your body, on the surface of your body, and outside of your body, all around the outside in the networks out there, out as far as the universe, far. Okay, it's not just in this world, it's out, all in the jinn world as well. It's outside of your body, basically. Okay, so what it is, what this freeze does, it just stops them, turns them basically into statues, so they can't do anything, and that applies to all of the spiritual diseases. So number 1 here, no shape shifting of the 24 spiritual diseases. The SDS just means spiritual diseases. There's no shape shifting of the 24 SDs in all 4 areas. Okay, no shape shift, not moving around, because the jinns will move them around and shape shift them and change them. Basically, no moving, meaning completely static, like statues of the 24 SDs in all 4 areas. No functioning, meaning no working. It's not working. It doesn't work. Okay. The jinn not working, even like the whatever the hasad was given for the sihr, it's not working. Whatever the spiritual the device is not working. No function of the 24 SDs in all 4 areas. Okay, none of the 24 SDs releasing all, many, several, some, a few, 2 or 1 or any of the 24 SDs in all 4 areas. Basically, what we came across is that when you hit them with Ruqya, and I had this problem. Well, I had one of these issues. That's why this intention comes from my case, actually. Where if I read Ruqya on a particular network, as soon as the Ruqya would hit it, they would release to 24 spiritual diseases. That's why I knew that, this number is true. It's only going to release 24 spiritual diseases, 24 from the 24 categories. It was not going to release 25, 26, 27, 23. It was 24, the number we came across when we were diagnosing the patients, you see. So what it was, so this thing was going to, as soon as I was going to hit Ruqya, it would change to avoid the Ruqya, and it would release all of these spiritual diseases against me, you know. But alhamdulillah, what we did, I asked Allah to freeze this network, and don't let it move around, don't let it get changed, don't let any jinn touch it or move it or shapeshift it or do anything to it. And alhamdulillah, Allah subhanahu wa ta'ala did that. So that's what you want, basically. You want everything just to stand still, no movement whatsoever. You see, you don't want anything to be released. You see, so number 4 is actually just stopping any spiritual disease, releasing something. You don't want that happening. Devices going off and it just sets something else off. You see, so that just stops everything, all of that, and nothing moves around, basically, and nothing gets released. Number 5, none of the 24 SDs creating networks, all external or all internal, direct or indirect, or both in all 4 areas. So no networks produced or created, basically. So all of the networks are frozen and you don't get any more new networks happening, basically, you see. Number 6 applies to all active and inactive SDs in all 4 areas. Yep, so sometimes you'll have an active SD, spiritual disease, which is affecting you directly, or even indirectly, but it's affecting you. And then you have inactive SDs, you see. Now, what happened is when we were doing these intentions, we found that when we improved them, the current ones we've got now, alhamdulillah, doesn't have any defects. And the jinn are actually, one of the reasons they attacked us was because they couldn't find any defects in the new intentions we're using now. And that's one of the reasons they attacked us, you see. Because the new intentions we used, I was wondering why are they so determined to attack me like this? What's going on? One of the reasons was they couldn't find any more defects in the intentions, the new intentions that we will talk about in the next video, inshallah ta'ala. You see, they couldn't find any defects in, and hence they were attacking me because of this. You see, that's one of the reasons. There were other reasons we said as well, but one of the main reasons is this, that they couldn't find any defects. The other intentions I did use in the past, there were some defects for them, so they could get away from the Ruqya somehow and some way, you see. But the latest intentions, alhamdulillah, they're on target, alhamdulillah, hit the nail on the head, basically, alhamdulillah, so they're the best ones we've had so far, and the proof of that is the way the jinn are attacking me. Like I said, I've not been attacked for 11 years, and now they're attacking us, alhamdulillah. So number 6 here, so we had what we had, and we improved it because we didn't know about this until that's how we in the last 2 months we will improve in those intentions. And you have jinn which are actively attacking you, so they're inside you, they're inside your networks, and they're doing things. Just outside, maybe on the periphery, you're going to have these jinns who are just hanging around. They're not doing anything to you, they're just inactive, just standing there, not doing anything, you see. So the reason they do that, we realized, so the brother would, when we did Ruqya, he would kill all the active jinns because they were attacking him, basically. They were the ones who were attacking him. So they will go. Next thing you know, we got all these other jinn coming in. And then what's going on here? So when we did diagnosis, a thorough diagnosis, what is going on? Where did these other jinns come from? I said, were they part of your network before? We do all this sort of diagnosis. Oh, Allah shows if these jinns were part of the network before. They were. Okay, so wait a minute. They were part of your spiritual disease. Well, where did they come from? How come the Ruqya didn't hit them? Because what it was, they were using this as, they found this defect in the intentions. The intentions which are before the ones which I'm going to teach you next week. They found a defect which we just put active jinn. Look at them, what details they go to. They found that defect, active jinn. So they said, what? The inactive jinn are not included. So what we will do, we'll just stay on the periphery. We'll wait. We're part of the spiritual disease, but we're inactive. So we're not included in this intention. So all the active ones will die, and then afterwards the brother will just relax, chill out, and then he'll get attacked by this new set of jinn. And we'll say, where did these ones come from? I thought we killed all the jinn. And when we check, Allah shows if we killed all the active jinn, meaning that's what we sort of had in our mind and our heart when we're doing the diagnosis. Yes, so you get a reaction, all the jinn are dead. And then thorough diagnosis, we realize, okay, we've got jinn hanging around, inactive, just waiting. So we've got to include that. So we added that word, inactive, as well. So active and inactive SDs. And you know what's happened now? Which we found out recently. What's happening now when you got these jinns? So now you've got they don't become part of the spiritual disease. What they do, they stay away. They don't add themselves to the network. They know if they become active or inactive. As soon as they hit the networks, they become active. They become part of the spiritual disease, and then they'll start. Then they will get hit by the Ruqya. So they want to avoid that. So what they do, they don't become part of the spiritual disease. They wait. They wait until you move on to part 2 of the Ruqya intentions, and then the old Ruqya, we had a part 2 Ruqya intentions, and what they would do, the patient would finish part 1, Jinns are waiting. They're not part of the spiritual disease now. And you know, this is after we dealt with the active and inactive thing, and we got rid of that. We put that active and inactive in there. What the jinns were doing, well, we're staying out on the periphery waiting. We're not part of the networks yet. We're not part of the spiritual disease, so the ruqya is not going to hit us, and it won't hit them. They'll see all the other jinn dying, and then what would happen when the patient would move on to part 2? Then they would join the network, and they would become part of the spiritual disease. How do we find all this information out? By Ruqya diagnosis, because we get shocked. Where did these jinns come from? What's going on? We realised these jinns were waiting until the patient moved on to part 2. When she moved on part 2, then they joined the networks, you see. So in order to deal with that situation, what we did, we realised we had to join part 1 and part 2 intentions together. Join part 1 and 2 intentions together, and then that became very effective now, alhamdulillah. So it dealt with this situation. But yes, you will still get jinns coming through, but in the end, you just keep knocking them down, and you will get the cure, because they cannot just keep sending jinn. It just can't happen, you see. In the end, they just have to give up, you see. And that's the reason why they were attacking us, because they realised, and that's one of the things they were after me for teaching as well. They didn't want me to prevent me from teaching, joining part 1 and part 2 together, you see. Joining part 1 and part 2 together. So I've gone off on a bit of a tangent there, but I think it was important just to explain this, look how the details they go to. They found that defect inactive. I didn't mention inactive. So they would wait and then use that against us. But alhamdulillah, we got rid of that now. Alhamdulillah. So this applies to all active and inactive SDs in spiritual diseases in all 4 areas. Okay. So that's number 6. Disconnection prevention of any part of the networks or all networks, directly, indirectly, or both, in all 4 areas. So what that basically is, they disconnection and reconnection of the networks. So they'll disconnect and say, well, this network is not part of, a load of jinn will disconnect themselves from the networks or take a whole network offline, so it's not part of your disease, and then reconnect as well. After you moved on to something else, so you stop the ruqya, then reconnect, you see. Well, this intention will stop them doing that, you see, because it will just freeze the network, so they can't disconnect it. So when it's connected, and the ruqya will hit it, inshallah ta'ala, you see. All of these things what we were dealing with, and this freeze ruqya, alhamdulillah, deals with all of this. It's all, their methodology is just to avoid the ruqya. Do anything to avoid the ruqya, you see. Move around, change definitions, alhamdulillah, this freeze ruqya deals with all of those problems. The problems which they caused, Okay, so that's the disconnection prevention. Okay, so they stop them disconnecting networks and adding them, adding, and doing switching on and off, basically. Try to avoid the ruqya, you see. Because what that means is that they'll switch it off, they disconnect, say, oh, well, not part of the network now, so the ruqya can't hit us. We could just wait here, and when you move on and you stop your ruqya, okay, reconnect. And then they come part of the network. You say, oh, and then you find out where these jinns come from. And then you do, alhamdulillah, through ruqya. I mean, if it weren't for ruqya diagnosis, we wouldn't know the jinn doing all these crazy things. I mean, you'd think that the jinn don't do stuff like this, but they're very smart, when it comes to sihr, they're very smart when it comes to sihr, and attacking us. Number 8, disconnect and reconnect phenomenon. Okay, what that is, disconnect and reconnect. So they're on and off, on, off, on, off, off, on and off. That's what they would do there. Sorry, the other one, number 7, was stopping them, preventing them from cutting off from the networks. Okay, cutting the networks off. When they see what they do sometimes, if the ruqya is too much for them, they will cut it off. So they say, okay, we all survive now. So no, this will stop them doing that, because they might just cut off the network, so all of the jinn in that particular area, in that part of the network, will survive the ruqya. They won't get attacked by the ruqya because they've cut themselves off from the network. Okay, so that's what that was. I made a mistake there, sorry. So that's what 7 was all about. Stopping jinn do that. Number 8 is where they disconnect, reconnect. So disconnect when they see that you're doing your ruqya. Then reconnect it when you finish doing the ruqya. They do things like that, you see. So by having these 2 intentions, is make sure that the networks get stuck, and the jinn get stuck in their networks, and they can't just run away. That's what that is all about. Number 9, all of the above occur permanently during ruqya treatment and outside of it, and in all 4 areas. And that's important to know that. So once you finish the ruqya, everything is still frozen. And we've had patients like that when it's still ruqya and they check themselves, oh, the jinn is still frozen inside, they're not moving around. Alhamdulillah. Yeah, and that's what that is good about. Alhamdulillah Rabbil Alameen. Number 10, I just added this extra in there. So, additionally, for all active and inactive jinn and maqareen and the qareens of other people, if they have become SDs. And this is a point just to quickly explain. We've come, surprisingly, which this is something which really shocked me in the last 2 months, qareens become spiritual diseases. I never come across this thing before. I never even thought this thing is possible. I've heard of people talking about it. I've heard of Rakis, and I've checked one Raki, a group of Rakis' intentions, and I saw them putting that in. I said, really? I've never come across that. And I never really, maybe I should have spoken to them, but I never really spoke to them about it, you see. And sadly, we don't have some sort of like yearly conference of Rakis getting together and telling people about their experiences, and we don't even have any of that. Just like you have doctors get together, scientists get together, and they discuss things. Well, there's nothing really for the Rakis, sadly. Everybody's doing things on their own, you see. Some of you might discover something, no, we don't hear about it, you see. But I did hear about it from a few Rakis before, that they were dealing with Qareens who were doing strange stuff, and I came across it, you see. So it seems that when the jinns and the sahir becomes very desperate, they would resort to talking to the person's qareen to do something. Hey, do something for us now. You can see we're in pain, we're in trouble now. We need your help. And then when the qareen starts doing things, you see, more than what he's supposed to do. So then what happens? The qareen develops into a spiritual disease because he's gone beyond his bounds, what he was supposed to just do. He's just supposed to just give you waswas, you see, But he's gone overboard, and then what happens? He actually becomes a disease, meaning he will start reacting to the ruqya. And we've had cases like this, you see. Like this particular case, I was dealing with the brother in order to try to avoid the ruqya, what the jinn were doing, because they were after this brother, and it's one of my senior students. They were after this brother. Okay, at the same time, sort of they were after me. But I didn't get attacked by the Qareen thing. Qareen's coming into me. What was happening? They were using jinns which were Qareens on him. So when he would read the ruqya, he would not think that his Qareen is attacking him, and he's getting Qareens from other. So the jinns which were coming in, they were Qareens of other people. Somehow, I don't know how those jinns have done it. They convinced Qareens from other people to come in and enter him, basically. So they will possess him. You see? So when he would read the ruqya, side, I'm not reacting, side, but what's going on here? I said, no. I said, you've got to, I said, you have to change your definition here. I'm getting these jinns, but I'm not reacting to them. What's going on? I said, change your definition. The Qareen has become a spiritual disease, brother. Once he changes definition, then he starts reacting to the Qareens. I said, side, all of them are Qareens. That are Qareens of other people. His Qareen was attacking him, and the jinn have sort of recruited Qareens from other people, because the brother, alhamdulillah, had dealt with the jinns from other the jinns, which are the normal jinns, which were part of the sihr. Now, when they ran out of those ones, they will start to use Qareens. And the reason they're using Qareens is the simple fact that they're trying to avoid the ruqya. Because the brother's not going to make intentions for Qareens. He says, Qareens? What's that? And obviously he's learned from me, and I'm telling him that Qareen is not a spiritual disease, brother. But then we realize, this thing is, this is, we've got to change this opinion now. So that's why you've got this in here, you see. Additionally, all active and inactive jinn and maqareen and the Qareens of other people, if they have become spiritual diseases. So it's not for everybody. I've checked, let me see now, it's about 4 people. I've come across 4 people whose Qareens have gone against, who've become spiritual diseases. So it's not everybody, But it's important to check for that. And I think that would be one of the diagnoses you're going to have to do. You're going to have to check to see if your Qareen has become a spiritual disease, basically. Okay? So the intention, this freeze number 10 will cause no waswas. So no waswas from any of those jinn, even the Qareens. No sight, so they're blinded, basically. No hearing, no listening, deaf. No reading of mind, because the jinn can read your mind. There'll be no reading of mind, no speaking, no non-verbal communications in all 4 areas, meaning paralinguistic sort of feature things, where they sort of like use their hands and wink and things like that, sign language. None of that will happen as well, because you've made intentions for that. So now they just become like statues, and then they can't see anything as well, a bit like what they do to us in sleep paralysis, as the brother was saying to me. I said to the brother, so now we don't like that state. They don't like this state as well. That's what happens to them, alhamdulillah, which is good. It's good for them to go through that as well, alhamdulillah. So yeah, so that's important to do this before you actually do your treatment. Before you do, just freeze everything, ask Allah to freeze everything, and then you do your thorough ruqya diagnosis. You see, yeah. Okay. Additionally, I did say you check for those you check for sihr and who's giving you the sihr. You check for kabal sihr and who's giving you the kabal sihr. Hasad and who's giving you the hasad. Ain and who's giving you the ain. And kabal ain and who's giving you the kabal ain. On top of that, what we need to do is check if your qareen has become a spiritual disease. Very simple diagnosis. You're going to read sort of Nas, come to the last ayah, min al jinnati wan nas, min al jinnati wan nas, and you ask Allah subhanahu wa ta'ala to show you if your qareen has become a spiritual disease. You see? Now, this is an important point, and that's what the issue the brother had, okay, is that your qareen could become a spiritual disease. It becomes a spiritual disease in your body, but it might not necessarily attack you. It might be attacking other people. The other jinn have recruited it and it's attacking other people. So you have to bear this in mind, that when you're reading, don't think, oh, Allah has my qareen become a spiritual disease for me. I mean, it's a spiritual disease and is attacking me. That's what your definition of a spiritual disease qareen would be. And I would say, no, don't do that. Just do it where if the qareen is attacking other people or even myself, whatever the qareen is doing, if it's become a spiritual disease, show it to us. Allah knows if the qareen has become a spiritual disease, obviously. So you're asking Allah, show me if my qareen has become a spiritual disease, either attacking me or attacking other people or whatever. If it's become a spiritual disease, whatever the way it's become a spiritual disease, don't restrict it. Don't just restrict it to as well, where if it's attacked me or others. Well, it might not have done that, but it still might have become a spiritual disease some way, somehow. Whatever the way it is has become a spiritual disease, you ask Allah subhanahu wa ta'ala to show it to you. Okay? That's important, you see. Because I remember there was a case, or one of the diagnoses a person did, where they're doing, I'm not getting a reaction from my qareen being a spiritual disease. Yeah, because the qareen wasn't attacking the person. But when they changed that intention, that even if it's attacking other people or whatever, show me if it's a spiritual disease, then they got reactions. Because the qareen wasn't attacking the person the person who had that qareen. You see. Alright, another diagnosis you need to do would be to check for vaccines. Any vaccine spiritual disease, especially the COVID one, you know. To check that one, you will use again the last ayah was Surahs Nass, min al jinnati wan nas, to check that one. So you see any vaccines, any spiritual diseases from vaccines, especially the COVID. Okay. Check medications and supplements. We had a case where the sister's medications from the doctors actually had spiritual diseases in there. Subhanallah, you know, and it was one particular sister. It was one of the drugs they use for cancer. I think it was. It had a spiritual disease in it. Subhanallah, you know. So you have to check yourself for this. And another sister, she took some supplements, some of these new age sort of supplements some people take, whatever. They got spiritual diseases in them as well. You see. So I mean, there's only one case with the supplements and one case with the medications, you see. But it's worth checking. You don't know what's going to happen, you see. I would do that diagnosis. And I've actually put that, because it's unusual and I was a bit worried about other people having this sort of problem, I put that in the intentions as well. I just put it in the new intentions. I said, if there's anything like that from there, ask Allah to get rid of it as well, you see. You might want to look why you got the ayn and why you got the hasad, you know. Is it for your hair? Did you get the ayn for your hair, for your business, for your marriage to your wife or whatever? And remember, sometimes you could be the object. I was dealing with a case today where the sister, when I read on her, she had hasad. She reacted to hasad. And I looked at the case. I remember I had a similar case to this before. I said, I don't think she's got hasad for. I know she had sihr from some particular man who had given it to her husband. So I said, I think she's going to have indirect hasad from that man, that sahir. That's what it is. And she reacted to that. And what that was is that that man obviously wanted her, basically, was attracted to her and he wanted her and he was jealous that the husband had got her, basically married her, you see. So, yeah, so it's important for you to check yourself. Are you a hasad object yourself? Have you got, that's what happened to me, isn't it? I think I said that in the last video or the one before that, where I myself was an object, and my wife was the direct object. So a sister who wanted to marry me basically gave hasad to my wife, and then my wife basically was the direct object, and then I became the indirect object. So if I read on myself, I got hasad. I would have hasad. Where's this hasad come from? We worked out it's coming from that. It was coming from that sister, basically. So it wasn't direct hasad hitting me. So you have to work out all of these things as well, basically. You see, what would help you is watching that advanced Ruqya diagnosis video. Really, that would help you, inshallah ta'ala. You know. When you come to Qabal Ain, one of the things you can do, check if they've given you the Qabal. If you react to Qabal Ain, check if they've given you the Qabal Ain deliberately, because it seems that some people, they know that they're giving it, you see, and they deliberately do it to kill you. So they know they're giving it to you. They look at it in a certain way, and they give you that. I remember one brother was telling me when we did the diagnosis on and he was telling me that he actually remembers this woman. She's an evil woman, and she had given him hasad or Qabal Ain, I think. And there was one woman complaining about a bad back. Oh, my back is hurting me. And he said he saw that woman who gives people Ain go into them. Oh, is your back hurting you? Is it still hurting you? And she was doing that, and he could sort of tell that, hey, that woman's giving, because he knows and what she's got. He could tell, hey, how's your back? Is it hurting you? Ooh, what about now? What about now? Is it hurting you still? What about now? And he said he could see that she's actually giving her Ain, and the person doesn't know this. She's like using her as some sort of experiment kind of thing, you see. And that's what they do. They just have fun with this stuff, you know. That's what they do. They'll do sihr on you for fun, and then just enjoy it was like a game for them, basically. See what happens, you see. And he said this what this woman was doing to this other woman. He said it because he knows, because he had Ain from this woman, or Qabal Ain from this woman, and he's just standing there watching what's going on. He said, and he was amazed. He said the way the woman is talking to the other woman, and you think she's trying to help her, but he knows the way she was looking at her. That's not helping. She just wants to see how effective her Ain is, basically, or Qabal Ain is, how effective it is. Is it how about now? How about now? Is it better now? What about now? What about now? You know. So he stepped back and he said, no, I knew what was going on their side. You know, Subhanallah. Allah save us from these people, you know. Then you can obviously check for sihr, Qabal sihr. Have you got sihr, Qabal sihr or sihr for to kill you, basically, for work reasons, for money, for divorce, or to prevent marriage, to prevent you having children. You know, you can check all of these things, you see. I mean, doing that will make it a little bit easier. So when you come to that question, oh, well, it shows if we've extracted all the information, you most likely will get a reaction for it then, because you've done quite a thorough diagnosis, you see. You know. See, the point here is that we should do our best on our side, try to do as much as we can with regards to the diagnosis, and then ask Allah subhanahu wa ta'ala a question. Oh, Allah, show us if we've extracted all the important information, you see. Yeah. Right, this is an important point. I just realised here, yeah. When you're reading for a particular person, you're reading for someone, okay? And you come to the point where you're trying to work out who's actually done the sihr. So it's just one person who's done the sihr. One person's the sahir. So then they tell you, oh yeah, Uncle T. Uncle T, okay. And so he's got Uncle T, and what is it? He's giving you a few names. Uncle T, Mrs. S, and Mr. D, whatever, you know. And then so you're reading for Uncle T. And you're reading for that. And you're not told the patient what you're reading for. They don't know you're reading for Uncle T, but you're reading for Uncle T. So you carry on reading, and then the patient's eyes are closed, and then, you know, and then they actually see Mrs. D. You're reading for, so my intention is Uncle T, and he's seeing Mrs. D. And then you say, oh, so Syed, I say, okay, what happened? Oh yeah, I saw Mrs. D. You saw Mrs. D? And I'm thinking, I'm reading for Uncle T. You saw Mrs. D? I said, all right. So then what I would do there, I mean, it's only happened to me twice, but it might happen to you. I said, okay, brother, is that what you saw? Yeah, I just saw her, brother Syed. I saw her face clearly. All right. So I stopped the Ruqya. So let me read for Mrs. D. Allah's made it maybe easy for us. Oh, I think it was someone who was not even in that list. That's what it was. I think it was not even in the list, maybe. Yeah. So then he told me he saw that person. I said, really saw that person? So then I would just use that person. Allah shows if all of the sihr is from this person, and then then we'll get reactions, you see. And I said, okay, brother, it's that person. So what you have to note down, if you see a vision of something, the patient sees a vision of somebody, then stop the ruqya, and you're reading for somebody else. Okay? Stop the ruqya and then focus on that person. Read ruqya for that person, you know. And what this is basically, I've only had it twice happen to me. It's just way Allah helps you get to know who the person is, because it could be a long process to work out who this person is sometimes. I'm telling you. It could be very tiring because the person has no clue of who he is, and you're just going round in circles and know what to do, you know, how you're going to work this one out, you see. And sometimes Allah, by the mercy of Allah, Allah just gives the person the vision, oh, it's so and so. And then you can stop your ruqya and say, okay, let me check for that person. And then you see that the person reacts. I've had that for ayn, and I had it for sihr once. So it might happen to you. So if it happens to you, what you do, stop the ruqya you're doing for that particular case, and then you read for that person that the person saw, you see. Yeah. And make sure when you're reading the ruqya, make sure the room which you're reading it in is dark, you know, or maybe you might have to get them to wear one of those sleep masks, you see, cover their eyes to do that ruqya, because, you know, if the room is too bright, they're not going to see the visions well, you see, you know. So you want to get rid of that problem, you know. Yeah, so when you've done all of that, then you can ask the question, oh, Allah shows have extracted all the important information from the spiritual diseases. Yeah, and if you get a reaction to that, obviously, when we get a reaction for that, Allah shows have extracted all the important information from the spiritual diseases, then you can move on to treatment, inshallah ta'ala. You can, and if you do this before I've put out the new treatment intentions, then just go back to the old ones which I've put out, which are out there anyway in the previous sort of videos I've done. Look at those intentions and just use those intentions for now until I do the new ones, inshallah ta'ala. You know? Yeah. If you get no reactions for this, when you get no reactions for this, let's say for instance you don't get any reactions for this, and you've done quite a thorough diagnosis in your opinion, but you didn't still get any reaction, then what you would do, most likely then, it's just going to be 2 or 3 pieces of information, no more than 3, hopefully, inshallah ta'ala. So what you would do, you will ask Allah subhanahu wa ta'ala, Allah, show us if it's just 1 piece of information I need. First of all, that's what you do. If you got no reaction, okay, then do, Allah, show us if it's only 2 pieces of information that I need for my spiritual diseases. You see? And then you do the third one. Allah shows if it's only 3 pieces of information. You must use the only. So once you get a reaction, you definitely know it's only 3. You're not going to be looking for 2 or 3. So don't just say, is it 3 pieces of information? No, make it very specific. Allah show if it's only 3 pieces of information I need, or is it only 1 piece of information, or is it only 2 pieces of information. When you react to that, you definitely know it is only 1 or only 2 or only 3. It's not unclear. It's clear that it's only 1 piece of information or 2 pieces of information or only 3 pieces of information. The next thing you would do, then you'll go through. Is it only to do with the sihr? Those three. So let's say for instance it's 2 or 3 or 1 even. Is it all of these 3 to do with sihr only? You get a reaction. Okay, you're only going to be looking at sihr, and what that could be, if you already know who the sahir is and that, and the sihr, then it would be obviously to do with what he's done to you. One of the things you would check is, has he done sihr to kill me? You see, and you might have to check for any other things he's done. You see, it might be to do with ta'weed, I'm not sure, or it might be to do with sihr object, meaning there could be something in the house which you keep touching and hitting you. Sihr keeps hitting you. You see, that could be that. You see, but that's how you restrict it. You must use that word only. You must restrict it like that, so it helps you to just focus on certain areas. So you might just it might just be the sihr you focus on, and you just get all the information. You know, you're only dealing with the sihr. You see, and what you do there, you look at the previous notes. What have you discovered from the sihr, from your thorough diagnosis, and you look at what you've done, and then you just choose. And then work out what could be missing from your diagnosis. You see, usually for something like that, it would be something to do with the type of sihr is done, on the person. And what I've come across when I was doing that is usually the patient needs to know that so and so wants to kill them, and they get shocked. So my uncle wants to kill me? And you can't believe it, you know, subhanallah, you know. And I think I had one case where recently where it's the father who wants to kill the son. Subhanallah, you know. So it's sihr to kill, you know. And so that's the important information that the person needs, you see. Yeah. Dave, before we go, one more thing before we look into this different cases, real life cases. Yeah, what we've noticed from the diagnosis is that you'll find that sometimes you react to a lot of things. So when I'm doing that sihr diagnosis, all it shows the patient's got sihr reaction. All it shows all of the sihr is from human sahid reaction. All it shows is only from one sahid reactions. So a lot of the diagnosis sometimes people get surprised. I'm reacting to everything. I don't understand what's going on. Well, what we've seen from experience, and this is my explanation to patients, and I explained to one patient today, is that Allah's keeping certain diseases for you. You probably had other sihr from other people. But what it is, what we've noticed from experience, usually it's just one person who's done the sihr on you. That's what I've seen. Let me give you, subhanallah, it might be now when I've been doing this thorough diagnosis, all of the cases I've dealt with so far, 90 to 95% of the cases I've dealt with is just one person doing everything on the person. The sihr, all of the sihr is from one person. Ayn and stuff. And a few cases as well where the hasad, the ayn, the kabal sihr is all from one person. You see? So the person gets a bit worried. But I'm reacting to everything, Said. What's going on? I said, yeah, it's possible. You know? And because I've got the experience when I'm dealing with this, I know where it's leading me, so I choose the appropriate diagnosis, and I usually I hit the nail on the head, and that's just experience, nothing to do with being intelligent or anything like that. It's just experience because I know I've seen the patterns. So when I see the usual same pattern, I know what to do there. You see, you know. So the patient got worried today, and said, "I'm reacting." Everything said, "Don't worry, this is normal. This is correct." You see, and what you can do afterwards yourself, you can check yourself afterwards. If you don't believe the diagnosis, then check yourself. If you don't believe what the person who's reading on you is saying, then just check yourself. Allah show me if I've got sihr from so and so. All of my sihr is from so and so. Check yourselves. You see. So what the conclusion I came to seeing all of this is that the reason why I believe you got why it is the way it is with regards to these spiritual diseases, Allah keeps something for you, but cures you from people who you're not going to see maybe again in your life, or maybe people who have died, okay, or strangers. So sihr from some so like for instance, ayn or hasad from a stranger on the train or something like that you met, or you walk past them. Allah will maybe get rid of that for you very quickly, and you don't know anything about that. Maybe while you're doing Ruqya training, you don't even know about that. You see, but then he keeps certain diseases for you. So then, because it's important for you to know about that person, you know, a particular uncle, or a particular relative, or a particular friend, subhanallah, you need to know about that. So then that spiritual disease stays there for you to find out about it, you see, and you can't get rid of it, you know. And that's just a mercy from Allah subhanahu wa ta'ala, that so we know who our enemies are, you know, you see. So that's the reason why people react to, it's just one person, but Sayyid, I'm reacting. No, it's yes, you react to that sort of, that when we do it like that, most places, as you will see, end up just being one person who's done it on them, you see. Dave, so let's pause it here for a second, and I'll get my notes, and we'll look into some cases now. Right, here's a case here on a particular sister. So what we did first of all, does she have sihr? And she reacted, you know, using the ayah, وَمِن شَرِّ النَّفَّاثَاتِ فِي الْعُقَدِ. She reacted to that. So she has sihr. Okay, there's sihr. It could be from the jinn, it could be from the humans. She's got sihr. And then I did the next one. Does she have kabal sihr? She reacted to that. It could be kabal sihr, could be from the jinns and the humans. So when I do a diagnosis, the general diagnosis for me first of all is any sihr. I mean, is this any sihr from the humans or the jinn? Just any sihr there. Reaction, okay, you got sihr. I don't know if it's from the jinn, I don't know if it's from the humans. Same thing with the kabal sihr, okay? The next diagnosis was is all of the sihr from only one human sahir? I did that one. Now I missed out is about the doing the is it all from humans first of all? I should have put that in there. For some particular reason, I can't remember now, I just went straight to, is it all from one human? It might be some of the information she's already told me that. Some of the background information I had from her. So that's maybe why I did that. But what you should do, first of all, is after doing sihr, have I got, if the patient got sihr, okay, is all of the sihr from humans, first of all. It's human sahirs. When you get positive for that, then you go for the one person. Or it shows if all the sihr is from one person, you see. For some reason, I didn't do that here. But there's something here. She must have said something to me. Then I do the same thing with the Kabal sihr. Is all of the Kabal sihr from only one human sahir? I do the same thing there as well. You see. So it's possibility. You can do that if you want to do that, you know. You might get a reaction for that, you see. This is what I want to really, one of the things I want to show here is I did this diagnosis. Is all of the sihr and all of the Kabal sihr from the same human sahir? Got a reaction for that. And that's what you find usually, that all of the sihr and all of the Kabal sihr is from the same human person who's did it. Then the next one I did is this one identified sahir a female human? Reaction. Okay, so we know the sahir is one person who's done both types of sihr on her, and it's one female human who did it. You know. Yeah. Then I did something here, which is all of the sihr and the Kabal sihr, is it all black magic? Okay. Now the reason I did that, or the reason I usually do that one, is just so if I got a reaction for white magic, then meaning the person's doing the magic for good intentions, they think that we're going to protect the person or to help their marriage or give them money or whatever. And usually that's something from the relatives, you see. But I usually do that when I don't know who the person is and the person has no idea who it is. So sometimes that leads me somewhere else. Oh, it's a relative. This must be a relative then. Then I'll go for relative. So if the person reacted to white magic, I say, okay, usually that comes from relatives. Then I'll check the relatives, you see. You know? It's all kufr and shirk. There's no good magic. There's no bad there's no good magic. It's all rubbish. So you can't do kufr and shirk and do sihr. Yes, the intention, they're doing it for good reasons. And sadly, a lot of people think this is permissible to do. It is not. It's all kufr and shirk. You know, in reality, there's no such thing as white magic. It's all just all kufr and shirk. Yeah, but you have to have that distinction because it would help you try to identify who the person is. So the person's maybe doing the sihr. You know, as we come across many cases like this, they're doing the sihr to help the person or protect the person. You see, so you have a father doing the sihr on his own son because he thinks sihr is permissible to do. You know, for some strange, I mean, they've got some strange evidences they will use, but they'll come tell you that no, sihr is okay. What I'm doing, I'm not doing it for evil purposes. I'm using good Muslim jinn to help my son. You see, but the son's having bad effects, brother. You can't be doing these sort of things. You know, so. But that's what happens, sadly. So that I only do that one just because when I don't know who the person is. So I got to find it. It will help me. I know it's a female. It's one female. She's the one. But who is it? Basically, is it a relative, not relative? That sometimes helps. That question sometimes helps sometimes to find out who it is. You see. Then what I do sometimes, if I don't know who the person is, sometimes I'll decide we don't know who it is. The person can't give you any names. Usually I've had, let's say about 75% or maybe 80% of the cases, the persons give me some sort of names because they have some sort of idea who's done the stuff on them, who's done hasad on them, ayn and all that. They also, and it's very helpful, alhamdulillah. They have an idea who the people are, basically, and they give you these 3 or 4 names and you can find the person from there, alhamdulillah. But sometimes when they don't know anything of the person, you can do what I do is I do this. I want to show us if the sihr is from someone. If the sihr is from someone, the patient will recognize when they see their face, basically. So meaning when they see the face, oh, they know who that is. Oh, that's so and so. Oh, that's the neighbor. Oh, that's the shopkeeper. They will know the person. You see. And if they react to that one, then sometimes I go on to the next one, which would be, I want to show us if the patient, the sihr is from a person, the patient knows their first name, basically, you know, it knows their first name. And then we've got those 2 things. So then we know that, oh, you definitely sort of know this person because if you saw the face, you know who it is and you know their first name as well. So it's just not the shopkeeper or something like that. It's somebody you know their first name of, and then we can talk about people they sort of know, you see. Who they're on with they know, you know, first name basis sort of thing, you know. And that's what I've got here, the next one, you see. So the next one was, after I've done the recognizing, and the next one is, oh, well, it shows that the sihr is from, and the Kabbalah sihr is from a woman, she knows her first name, basically. Yep. Then what the patient here had, she had an idea who it could be. You know what, mate, Syed, I think I know who this is. She did the diagnosis and worked out, and she reacted to that particular person, you see. And what that person was actually was a YouTuber who his sister was watching some makeup videos and that. And that's what she got the sihr from. And the sihr was, I'm going to check now, it was sihr of suicide, sihr to stop marriage, sihr to kill. She did all of that sihr, on the poor sister, And all this sihr to watch her videos and that as well, you see. And what the strange thing was in this case, this is why I'm bringing it up here, is that she picked up Ain, Hasad, and Kabal Ain, and she's never actually met the person in person, you see. Now, I never believed that you could get Ain like that. She said all she had was her Twitter profile photo, I think it was. In that woman only had that, and she gave her Ain, Hasad, Kabal, Ain, all through just her photo, and I was quite shocked about that. You see, subhanallah. Yeah. Okay, subhanallah. Just going through the file, I just saw this. I didn't do any sort of thorough diagnosis on the sister, but I've just realized for this poor sister, I didn't do the diagnosis. Well, it shows if she has anything that reacts to Ruqya. I just checked her for sihr, Kabal sihr, jinn possession, general hasad. Yeah. I mean, that I was back then when I didn't really know about all it shows that intention. All it shows if she has anything that reacts to Ruqya. So maybe I'll have to probably contact this sister and tell her, that you might have something, because she was complaining about something, but she didn't know what it was. You see, this new definition of spiritual diseases open up a whole new world to us, basically. You see, so somebody like this now, I'm going to have to contact her and tell her, look, sister, back then I only knew 9 or 10 spiritual diseases. All right, there are other things out there. You see, I've come to the conclusion it's only 24 now. I don't think they're going to add anything to that, because that's why the jinn are attacking me. Recently, because it's just 24. And when I looked at the diagnosis I've been doing, it's just 24. It looks like really it is just 24. You see, when I checked when I checked that, for instance, when I checked that, as I said earlier, that network they attached to me, which if I did Ruqya on it, it would release to 24 spiritual diseases. It would release to 24 categories of spiritual diseases. You see. So it's only 24. I'm quite sure it's only 24. You see. And that's what I extracted as well when I do the Ruqya diagnosis on myself. When Allah wanted me to know certain things about my diseases, it was the 24. About 5-6 times it came up. The reason why this attack has happened, it's about to stop you, prevent you teaching the side the 24 categories of spiritual disease. The 24 categories of spiritual disease. The 24 categories of spiritual disease. It came up about 5-6 times. You see, when I got attacked, you see. Yeah, so that's just something there which I just noticed. I think I'll just point out here, that you, in order to know if you're cured, you have to read that. Allah shows if I have anything that reacts to Ruqya, whatever it is. If I have any, and if something reacts, it means you've got something, and you have to investigate what that is. Right, we're going to the case now where I first did the thorough diagnosis on. Yep, right. So what I did with him, first of all, was general sihr. Again, from jinns or humans, he reacted. And what he said, he actually smelt some a burning smell. That's what he picked up. Then I looked for Kabal sihr, any Kabal sihr there. And he saw an image of a black kid with white teeth. That's what he saw. And he didn't know who this black kid was, you see. the next thing I did, and I did the same thing here. There must be a particular reason why I did this, but I can't remember it right now. But you shouldn't do this, okay? I did, is all of the sihr from only one human sahir. So I've skipped the one which was after general sihr I should have done. Is all of the sihr from humans, human magicians, human sahirs. That's what I should have done. Then after doing that, then I should go on to, is all of the sihr from only one human sahir. That's the next one you should do. But I got a reaction for that. Then I did, is all of the Kabal sihr from only one human sahir. Again, I shouldn't have done that first. I should have done the other one, which was, well, it shows if all the Kabal sihr is from human sahirs, and then do that one. Okay, yeah. The next one is all of the sihr and all of the Kabal sihr from the same human sahir. You got a reaction for that, and that's what you will usually get that. The next thing we did, he gave me some names. He gave me some names on who he thought maybe could have given it to him. Paternal uncle, wife of paternal uncle, maternal uncle's wife, distant female cousin, first ex-wife. And so we went through all those people there, and I did a general diagnosis. I want to show us if the sahid, because there's only one person we're looking for, is the sahid among one of these people. If you've got sahid from one of these people. And when you're doing a diagnosis, always try to mention the spiritual disease. Don't just say sihr from these people, or is one of these people the sahir. Don't do it like that. You want to confuse yourself. Mention the spiritual disease. Oh well, and write the intention out fully if you can. You know, I just obviously write little notes here, but when I'm doing this, I'm doing the whole intention is there basically in my heart. I want to show us if he's got sihr from any of these people. So sihr is mentioned there. You see. And then there are some, I have got some notes on how to actually write the intentions in my article, 7 Rules of Specific Ruqya. If you go there, you'll see I've got certain notes there, how to write it, you know, how to write out the intention, inshallah, to help you out. So please refer to that if you're a bit worried about how to actually word the intention in that, you see. Please follow those notes over there. And it's all in the article, 7 Rules of Specific Ruqya. Okay. So so we didn't get any reaction for that. So all of those people he thought maybe could have done it on him. It was none of them. So it wasn't his paternal uncle, the wife of the paternal uncle, maternal uncle's wife, okay, distant female cousin he had, first ex-wife. None of them, no reactions for any of them. You see, so it wasn't any of them. So we had no reactions. Then what would we go on to? Then we did is the sahid from a sahid who was told to do the sahid by any of those previous people we mentioned, meaning one of those previous people did they go to the sahid and ask for the sahid to be done? No. It looks like there was no reactions for that. Okay, then we went on to the next thing. Yeah, so the next thing we did was is the sihr from a sahir which is not from the above people, and it's from somebody else basically, and he reacted to that, you know, and after speaking to him, it was actually he was thinking that it could have been a generational sihr. So we did a diagnosis where I combined all of it, where we've got a sihr is a sahir not from one of the people above. It is but a person who did generational sihr on the father, and all of the sihr and the Kabal sihr is generational sihr. So after I have a conversation with him, I did that. So it's a lot of information packed in there, basically. So I'm not including any of those people. So it's a sahir, but it's not none of those people. And this person, this sahir, has done generational sihr on the father, and that's how this brother got this sihr. Got this sihr, and all of the sihr and all of the Kabal sihr is basically a generational sort of sihr on the brother, and he reacted to that. Subhanallah, you know. So we got that, you see. Yeah, so there's all this sort of a generational sihr, you see. Now regarding that generational sihr, I was dealing with one case where the person, when you read on him, yeah, he's got a generational system from the father. Then the brother asked me, what about my children? Does that mean my children definitely got it, brother? Because I've got it. I said, no. I said, no. You have to go read on your children to find out if they really do have it. You see? Just because you've got it, it doesn't mean that your children are going to have it. You see? Because it might just skip a generation, you see? And it's up to, and in the end of the day, it's up to Allah if they're going to get it or not, you see? Right. So then we worked at it's somebody who's done this generational sihr on the father. Then one of the diagnoses we did, okay, well, it shows if this sahir is alive. Basically, is this person alive? This person's alive. Then we did it. So the sahir is alive. Does the patient know this sahir? Well, it shows if the patient knows this sahir. Basically, does he got sihr from the patient? If he knows them, basically. Or he knows their first name. No reactions. You can. And then I did where something where has Faraz actually seen this sahir? You know, has the person actually seen this person? Has the patient actually seen the sahir in real life? No reactions. You know, no reactions. So the person has not seen this. So the person has not seen this sahir. You know. So he's got sihr from a sahir he's not seen. Okay. Then we got here. Then the sahir was actually told to do the sihr by somebody else. You see, somebody else told the person to do the kabal sihr and to do the sihr. Okay. And they actually did react to that. Going back to see the notes here, they did actually react to. It's one of those people in those uncles or those aunts. They actually did go to the person, and that's what you find sometimes that Now I just noticed I've done this diagnosis twice. Okay, I see now. I didn't put any notes there because I did say it was no reaction. Actually, it is a reaction because I got it down here. So what it was, the person, the sihr is actually from one of those people. They went to the sahir and they did the sihr on. They requested the sihr to be done, basically. So those names those people he suspected, the paternal uncle, the wife of the paternal uncle, the paternal uncle's wife, distant female cousin, first ex-wife. One of those people went to a sahir. That's what it was, you see. You know, they went to the sahir and asked for the sihr to be done, basically. Okay. And then you just went through the names, trying to work out who that person was, basically, you know. Yeah. So what it was, he ended up being he ended up actually being two people from there, you know. So actually two people went to this sahid. You know, it's not just one person. Some or any, because in what that diagnosis I did here was the sahid told to do the sihr and the kabal sihr by some or anyone in one. Those names that he mentioned, and it was actually two people. It was his uncle who died, who's his paternal uncle, and his paternal uncle's wife as well. They went and they did this, you see, you know. And then he described to me some incidents which happened, and there was an imam and there was a Quran teacher he described. So I said, okay, maybe it could be this person, you know, who they went to. So I did a diagnosis, just taking that information from him, and he reacted to that person. So it was this imam and this Quran teacher he described to me, you see. You see, you know. So it was that Quran teacher who he described to me. Then I got him to do some sort of diagnosis by himself, and he did a diagnosis. Allah show me if the sihr or the kabal sihr or both is negatively affecting my business. So we did sort of a self-diagnosis. Now, what you do when you're dealing with sihr and kabal sihr, and to make things easy, because they're all sihr, aren't they? But sometimes it doesn't really matter if it's the kabal sihr which is causing the divorce or the sihr which is causing the divorce. You don't really need to know. It's just the sihr, one of those sihrs which is causing the divorce. That's the main thing. So here, or it could be both of them. So when I'm usually dealing with cases like this, when a patient asks me, okay, if I got the sihr of divorce, what's exactly causing this problem, brother? Then what I would do is, I'll show us if it's the sihr or it's the kabal sihr or both of them causing the divorce. Give us reactions if it's the sihr or the kabal sihr or both that are causing the divorce. And that's what we've done here, but we've not done it with divorce, we've done it with the business, because he's got problems with his business. So we've done here, I want to show us if the sihr or the kabal sihr or both are affecting his business negatively, and he gave us no reactions there. You see, Dave, you could do the same thing when you're dealing with hasad and ain, maybe. You know, if it doesn't really, maybe you don't really need to know which one it is for a particular reason, and just to save time, just do, is it the hasad or is it the ain, or is it both of them causing this problem, basically, you know? Then we did, does he have sihr or kabal sihr or both to prevent marriage? So no, he didn't have that, and we didn't even have for it to affect his business, because he was worried about his business. It wasn't there. So he's got kabal sihr in his head, but it's got nothing to do with his business. It's not affecting his business, and it's not preventing marriage. You see. And then what we was when we looked at that and we seen that it's got nothing with it, looks like, and it was generational sihr. So we said to him, okay, you know what? I said, you know, maybe the whole thing is just maybe just to kill you, basically. And alhamdulillah, that's what he reacted to in the end, you know. And that's just yes, it might have just been a guess, which I did, but alhamdulillah, sometimes guesses work, you know. So yes, and that's what he reacted to. So I did Allah shows if the kabal sihr and all of the sihr generation from the father is just to kill him, basically, and that's what he reacted to, you know. So when you're checking sihr and kabal sihr, sometimes one of the things I've seen here from experience is that when you see, one of the things when Allah wants you to investigate the sihr or kabal sihr, it's usually to find out it's the kill thing, you know. You find out that's one of the things you need to check for. Divorce is one of them, obviously, and the kill. They've done sihr to kill you, basically, you know. And you make your intention broad for this, the kill. So in a sense that they've done this to kill you, no matter how, whatever way it is, even if you're going to, they want you to commit suicide, because that's what sometimes it could be. Just is they've done the sihr to kill you, basically, you know. Don't restrict it to it's suicide this or to whatever for me to for jinn to kill me or whatever. Just say, is it sihr to kill, or other people to kill me, or me to kill other, you know, to be have a car accident or something like this. Don't just keep it, is it kill? That's what you want to know. Have I got sihr to kill me, basically? Don't restrict it. Just leave it like that, because usually you don't even have to really go into the specifics of it. Just once you know that it's for kill, that's enough, basically. So we realized that all of the kabal sihr, all of the sihr is just to kill him. That's it. Nothing else. You see? After we did, now because we did that, so I was thinking, okay, that's good. We got that information. So then we went on to the hasad. Does he have hasad? He reacted to it. Does he have ain? No reactions. Does he have kabal ain? He reacted to that. You know. So then we realized that he's got sihr, kabal sihr, hasad, and kabal ain. They're the things which were confirmed. You see. Then I did some other diagnosis, just checking for devices and waswas condition. Remember, this is the first time I was doing a thorough diagnosis. I didn't know if it was important or not. So now I realize it's not important even to check for waswas condition or even devices and objects. No need to check for those things. There's no need to check for those things. The main things you need to check for are sihr, kabal sihr, hasad, ain, and kabal ain. They're the 5 things you need to check for, and who's actually done it on you, and the reasons why they've done it, basically. You know, waswas conditioning, even jinn possession, you don't even really have to check. You know, but like I said, it could be. You might find that you might have to go back to certain things, like with the jinn, certain order waswas condition, because maybe it's causing a particular problem for you. You see. You find that out when you do that extraction question, you see. But like I said, we have cases where we just do sometimes those 5 things and some information, who's done all and who are those 5 spiritual diseases, kabal, sihr, ain, like I mentioned, and you find out who the perpetrators are, and maybe why you've got the ain and why you've got the sihr. Have you got the sihr to kill? A few of those diagnoses, and then the person's ready for treatment, basically. Alhamdulillah. Right. What we did next after that is the hasad only from humans, i.e. no jinn? He reacted to that. Is all of the hasad from only one human? No reactions for that one. Is all of the hasad from only 2 humans? Reacted to that. So it's important for you when you don't get reaction for one, as we said earlier, then you do only, is it only one? Is it only 2? Just the same thing when you're doing extraction, when you're trying to work out the extraction and questions, what you need to do and information you need to do. Is it only 1 piece of information, Ya Rabbi? Is it only 2 pieces of information? Is it only 3 pieces of information? And you get a reaction for 3 pieces of information. Then it's only 3 pieces of information. Well, here you do the same sort of thing. Is it only one person who's done the hasad? No reactions. Oh, well, it shows if it's just one, if it's the hasad is all from 2 people, only from 2 people, he got a reaction for that. You see, and then we did is all of the kabal ain from only 2 humans? I thought maybe it would be 2 humans. Is all of because the hasad was from 2, maybe the kabal ain was from 2. Is all of the kabal ain from only 2 humans? No reactions. Then I did is all of the kabal ain from only humans? Reacted to that. He reacted to that. So it's only from humans, no jinn. It's all from humans. Then he reacted to the number 3. He didn't react to 2, but he reacted to 3. Is the kabal ain from only 3 humans? Reacting to that. Okay. Are 2 of the kabal ain perpetrators the 2 who gave him hasad, and he reacted to that. So I saw that he's got hasad from 2 people, and he's got kabal ain from 3 people. So he's got hasad from 2 people, kabal ain from 3 people. And I was thinking, okay, maybe 2 of the people who gave him hasad have also given him kabal ain, and then that's what we reacted to. Are 2 of the, well, it shows if 2 of the kabal ain perpetrators are also 2 people who have given him hasad, and reacted. This is an important diagnosis I did here. Well, it shows if all of the kabal ain from these 3 people he's got the kabal ain from shows that if they have given this if they've given it to him deliberately to harm him, meaning they know what they're doing, they're giving it. And this is the case where I was telling you about that person who knows that earlier when I was saying that woman who knows she's could give that kabal ain or give hasad is one of this is the case basically, and this is the brother who described that woman, So they deliberately harmed the brother, and they knew that they were doing it. So you can check for that. Are they deliberately giving this kabal ain so he knows what he's doing, and they know what they're doing. So all 3 of them, they basically harmed him with the kabal ain, and they knew they were harming him. They knew that they were doing it. It wasn't a mistake. They deliberately did it. They deliberately did it to him. You see. Then I did here. Does he have hasad for his business? He reacted to that. Does he have kabal ain for his business? He reacted to that. Does he have hasad for being good? For being a good bachelor, sort of. So what they did, we had a woman, one of the women. They were sort of upset that he's doing so well and he's not married, basically. So she's given him basically kabal. She's given him actually hasad for that, and she's given him sort of kabal ain for that as well. Some woman, basically, she didn't like the fact, or she's jealous of the fact that he's doing so well for himself and he's not married, and who is he marrying? She really wants to know who he's going to be marrying. You see, and who is he going to marry? You know, he's doing so well for himself, and she was actually jealous of that. He was doing so well for himself, and she doesn't know who he's going to marry, basically. You know. Then we did is the auntie the one who gave Hassan and Kabal Ain? He reacted to that, one of the aunties. Is the other Hasida and the Kabal Ain perpetrator? Is it the sister-in-law? His sister-in-law? He reacted to that. And then getting some information from him. The last person who gave him the because there was three people. Remember, we got dealing with three people who's doing all of this. He described some man to me, and I did a diagnosis. The person he described, a jealous so-called close friend, previous sort of close friend, who gave him Kabal Ain, and he reacted to that person who he described, basically. Yeah. Just a side point. I just remembered I had a case today and about this Ain and Kabal Ain and all that, and this Hasad. This is just a Hasad coming from, this particular strange Hasad. She's jealous of him, and maybe even the parents and all of that. The very fact that he's a good man, he's a good young man, he's not married yet, and he's basically the very fact that he's not married yet and he's doing so well for himself. You see, she doesn't like that. Sadly, you got a lot of people, parents, the elderly, they get jealous of the youngsters, and they seem and because they sometimes think of their own children. So when you go on, I was dealing with a particular case today. His sister was really upset about her boy. He was so good side when he was young. He was going to the mosque and that, And I said, you know what? I've dealt with cases, I said to her, of people when these young 12-year-olds, 11-year-olds, 14-year-olds going to the mosque, praying in the mosque and that. The elders are upset and they're jealous of them. How come my son's not here and this guy's here? This kid's here and he's praying every day here. They get upset and they're jealous and they give them ayn and give them hasad, and that affects them. They get jinn possession, and then next thing you know, the person's not going to the mosque anymore, sadly. So it shows you how important it is to teach children. I said this to the sister, teach children when they're practicing like this. Look, remember now, when you start practicing, okay, you're going to have people, when you go to the mosque, they're going to be giving you this evil eye and that. So make sure you do your adhkar, okay? And don't try to stand out there as well when you go to these places, you see. Just do your prayers and come out, basically. Don't hang around there too much, you see. And maybe, don't make yourself noticed there, basically. That's what I'm trying to say there. Don't make yourself noticed there if you can avoid it. You see, avoid the aim from these people, basically. And the other thing which you need to tell people when the young people like that, when I said this to the sister as well, that when you got your children like that, 12, 14, 11 like that, started practicing like that, you've got to tell them, look, you practicing is not a normal thing to be, especially in this country. You're practicing, you're going to the mosque, coming back, and you're 12 years old. This is not normal. Okay, so the jinn are going to notice this, you see, and then they're going to just give you special attention. So make sure you do your adhkar. So you're worried about the people inside the mosque giving you ayn and hasad, okay, and also be careful of the jinn, okay, and the shayateen. Be careful of these devils seeing you, and they don't like the fact that you're young and you're practicing your religion. They're going to be coming after you. So make sure you do your adhkar, you see. So kids need to be told this, you see. Maybe if that kid, the person I was dealing with today, her son, if he had this information, maybe, inshallah, maybe he would have been like that, maybe. Only Allah knows best, but sometimes it's important to reflect and think back. How can we help people in these situations, you see, and give people certain advice regarding certain spiritual diseases, you see. So there's nothing wrong with trying to reflect and look back at those situations and you see other people going through certain things, and I've seen a lot of these children going into these problems. So it needs to be highlighted. We need to learn from our mistakes, you see, and learn from other people's mistakes. You see, we have to do this, you see. I think it's very important, you see. I've had cases like this where young men are going to the mosque and then they get hit by ayn and hasad from people who, they shouldn't be getting this ayn and hasad from these people, really, you know. Right, then what we did after that, we did that diagnosis. Have we extracted all the important information from this brother's spiritual diseases? No reactions. Okay. And then what it was, then we said, and then we did the diagnosis. Well, it shows if it's it's only about Kabal Ain. From the former close friend. No, the information was not from that person. You see, it wasn't from that person. Then we did after that. So we cut off from we knew it's not from that person. Then that person who gave him the Kabal and his former friend, basically nothing from that. So the information has got nothing to do with that person. What we need to do, okay. Then we did a diagnosis. So we got no reactions for that. So we knew it's nothing to do with. So we could put that person to the side. We don't need that person. Then we did. I want to show us if it's just one piece of information that we need. No reactions. Okay. I want to show if it's two pieces of information that we need. We got a reaction. We got a reaction. And then we did. Okay. Are these two pieces of information to do with the hasad or kabal, ain, or both? And we got a reaction for that. Alhamdulillah, we got a reaction for that. You see. Then after that, and then we did. And then are these two pieces of information? I want to show us if these two pieces of information are two pieces of information. One is one for Kabal Ain and the other for Hasad. We've got a reaction for that. So we know we only do need it's Kabal Ain and one for Hasad. You see. And then what we did is this the two pieces of information for Hasad and Kabal Ain, is it from one person? Got a reaction. So it's from one person giving this the Hasad and the Kabal Ain. And then it's okay. Is it from the auntie? And he reacted to that. You see? Okay. And then so we've got two pieces of information. But one is to do with Kabal Ain and one was to do with Hasad. So what I did then is okay, it's information we need from one of it's two pieces of information, but is it the same sort of information? Is it the same thing about his marriage or something like that, business or something? So I did a diagnosis. While I shows these two pieces of information that we need from Kabal Ain or Ain from the auntie, are they to do with the exact same thing? No reactions. So I knew then that it's going to be separate things. It's got maybe something to do with marriage. The other one's maybe got to do with business or something like that. Because then I did that diagnosis. All it shows that these things different. Reaction. We've got a reaction for that. And then I had a guest talking to him about what she was jealous about and stuff like this. And I said, okay, I know what it is. I think I've got an idea. All it shows if it's to do with all it shows these two pieces of information. Is it the Kabal Ain and the Hasad from the auntie is the Hasad for marriage and the Kabal Ain for business? And he gave us a reaction for that. Alhamdulillah. So we did that, you see. Alhamdulillah. And then what I did, we did I want to show us if he's ready for diagnosis, and alhamdulillah, he reacted to that. So alhamdulillah Rabbil Alameen. I've just realized that I've been speaking for 2 hours now, subhanallah. So I'll just give you two more cases. Here's another brother here, revert brother. So it was general sihr. So it could be from the jinns or the humans, So he reacted to general sihr. And is all of the sihr from human sahirs? So we did awala shows if he has general sihr, and he reacted. Is all of awala shows if all the sihr is from human sahirs, and he reacted. Then I did, is all of the sihr awala shows if all of the sihr is only from one human sahir, and he reacted. Then we had some sort of discussion from the feedback he's given me, and I did a diagnosis regarding some dead Algerian man that he knew. So then I did, is all of the sihr from this dead Algerian man as sahir, and he reacted, and I did that twice actually. So he reacted to that. Yeah, you'd be surprised, you know, people, scholars, so-called scholars are doing the sihr. So Arabic speakers were doing it on people, and these are people, you know, these are Arabs doing it. And you'll be amazed sometimes that a person's got so much knowledge, and you find, even not long ago, you find somebody who's talking about tawheed and shirk and sihr as well, and jinn possession, and then when you find that people react to them, you know, I mean, they've done sihr on people, you see. And even recently we came across some major Raqib becoming a sahir. It's shocking. These things are shocking. What we learn from this is that you never, never feel safe. Never feel safe. You know, we could end up being a sahir ourselves. You know, it's possible. You know, so we always have to seek refuge in Allah from all of these things. You know, I was shocked when I heard that particular Raqi, well-known Raqi, becoming a sahir. I said, what? Subhanallah. You know, Allah save us from this, you see. So whenever you come across these things, sometimes people are a bit shocked. How can that person be a sahir? But brother, he goes to the mosque, he prays, and he does this, and he does that, he talks about this. He's a Raqi himself. No, it's possible. Yeah, it's possible. You can come across people like this, you know, sadly. You know, so, yeah. So this particular person was a dead Algerian man who was a sahid. So you can find that sometimes a sahid is dead, you see. And you can get sihr, and the sihr is still there. Yes, sometimes you've heard of cases where when the sahir dies, the sihr goes, but not all the time. So all of the sihr was for this dead sahir, okay? And then and he said this guy had a terrible accident in one of these countries. He had a terrible car accident, subhanallah. And he said to me that the person was doing something in very. It seemed that from the information he gave us that person was doing something haram in a particular country where people just go to that country to do haram stuff. They don't do, when they go to this place, they don't do anything else other than do haram stuff there. You know, that's all that place is. That place is just famous for that, doing haram. And so that sahid was over there, and he died in a car accident over there. Subhanallah. Then I did the diagnosis. So he's got Kabal sihr, and he reacted. And use the same ayah. وَمِن شَرِّ النَّفَّاثَاتِ فِي الْعُقَدِ. Use the same ayah for that. Going back even like when you're doing hasad, Kabal, Ain, and Ain, all use the same ayah. وَمِن شَرِّ حَاسِدٍ إِذَا حَسَدٍ. That's what you use for that. When you're doing a diagnosis for vaccines and jinn possession and supplements and medications with spiritual diseases, and use the ayat mina jinnati wan nas, because it's from men and jinn. Basically, these supplements and things like this, you know, and these vaccines are from men and jinn. So you use that ayah for that, for those things, when you do that diagnosis. So let's go back here. We did Kabal sihr, and then we did is all of the Kabal sihr from humans as sahirs, and he reacted to that. So we only know we're looking for humans. We're not looking for any jinn, you see, you know. Then we did is all of the Kabal sihr from only one human sahir, and he reacted to that. And like as usual, as soon as I got that result, then I was like, okay, maybe the same dead Algerian sahir has done the Kabal sihr on this person, on this brother, and that was the case. When I did Awala shows if the Kabal sihr is from the dead Algerian man, a dead Algerian sahir, and he reacted to that, you know. And then I looked for hasad, and it was all of the hasad from humans, reaction. Is all of the Awala shows if all of the hasad he has, is it from only one human, reaction. Is all of the hasad from the dead Algerian sahir, and he reacted to that as well, you see. So yeah. Then what we did, the brother reacted to vaccines, you see. So It's just not the COVID vaccine that you're going to pick up a spiritual disease from. It could be the other vaccines are going to have something as well, as we've seen. So you may even find a simple meningitis or hepatitis A one. You might find that there's something in there as well. You see. So and that's all because of making this definition of spiritual diseases broad, and that's what we should be doing. You see. Anything that reacts to Ruqya. If something reacts to Ruqya, then there is a spiritual disease. It's not normal to be reacting to Ruqya. We shouldn't be reacting. Sadly, what I've seen, it seems that people now are trying to find excuses, and because they see people are just reacting, they never seem to be cured. Then oh, nobody will be cured inside. Everybody's going to be reacting. Well, if you're reacting, there's something there. If you're still reacting, there's something there. You've got to treat that. You see, that definition of the spiritual disease is much better to, because it exposes, it opens up all these other things that we were missing before. You see, and like I said, that's one of the reasons the jinns attacked me, because of that definition of the spiritual diseases. You see, you know, because sadly I think there are a lot of people out there just walking around thinking that it's only a certain fixed number of spiritual, they only have sihr. It's either sihr, ayn, hasad, jinn possession, and that's it. And if they're not, if they didn't react to any of those, then they haven't got anything else. And in reality, no, you could have something else. You see, you know, you could have something else that reacts to. You could have something else that reacts to Ruqya, but you don't know about it because you're not doing that diagnosis. Or it shows if I have anything that reacts to Ruqya. You see, you know. So this brother reacted to some was it hepatitis A and hepatitis B, I think, vaccine. He reacted to that. And the purpose of those, when I checked the purpose of the vaccine, the SD in the vaccine, the spiritual disease in the vaccine, it was just to make him vulnerable to spiritual diseases, so they can hit you with other things. You see, and that was the whole point of that. You see, right? Then he had Kabal Ain, and he reacted to Kabal Ain. Is all of the Kabal Ain from humans? Again, another reaction. Is all of the Kabal Ain from only one human? Reaction. I want to show us if all the Kabal Ain is from the dead Algerian Sahir. No reactions for this one this time. He didn't give me any reactions for those. You see, when we did this, he actually saw when I was doing that diagnosis. Because I'm reading for the dead Algerian Sahid, because he gave him the hasad, so I was thinking it's going to give him that ain. So I'm reading like that, and then we got the same thing happening here. He saw a vision of a man in the gym he's seen, you know. He saw a man, somebody else, you see. So I'm reading for this dead Algerian Sahid. I want to show us if the Kabal Ain is from this dead Algerian Sahid, because he's the one who's given him the hasad. So he must have, most likely that he's given him the Kabal Ain. No reactions. We know it's one person, and he saw a vision of this man in the gym, you see. So then I changed the intention. I stopped the Ruqya, and then I did, is all of this Kabal Ain from this man from the gym, basically, who he saw in the vision, the previous Ruqya. And the brother reacted to that one. So I said, okay, that's good. So it's that's the person who's done the Kabal Ain on him, you see. Then what I did, checked out, because as soon as I got a Kabal Ain, okay, let me just check him if this Kabal Ain was deliberately there to kill him, and he reacted to that. So I'll show us if the Kabal Ain was deliberately done for killing, and the brother reacted to that, you know. And all of the Kabal Ain was for killing as well. You see, subhanallah, you know. Then I checked for any Ain, and he got a reaction. Then I did. So he got a reaction for any Ain. He got a reaction for that. And went on to Ain. Is all of the Ain from humans? While I was reading that, is all of the Ain from humans? He saw images of three people. The one who gave him the Kabal Ain from the gym. He saw that person. He saw what he called a fake revert. Okay, he saw a fake revert. And then he saw a Turkish brother. He said he saw. You see. And he had no visions, but his body was shaking. I mean, sorry, he saw those visions. That's what he saw. He saw those visions. What I was reading for is all of the ayn from humans. So what I'm reading for that, Allah shows if all of the ayn is from humans. Because he reacted to ayn, could be from jinn or could be humans. So I did it. So the next diagnosis, Allah shows all of the ayn is from humans. And while I was reading that, he saw the image of 3 people. Like I said, the guy from the gym who gave him the Kabal ayn, a person he calls fake revert, and a Turkish man he saw. And then so when I saw that and he told me that, I said, okay, I think all of the ayn is only from these people. So I made an intention. I want to show us if all of the ayn he has is only from these 3 people that he has. And then he had his eyes closed, and then there were no visions, but his body started shaking. So I said, okay, that's the positive result for that one. No visions this time, because we've got that information. So the visions in these particular cases, which I had, it's only a few cases like this, 3 maybe it might be. This might be the 3rd one, which I forgot about actually. Where Allah sort of helps you and guides you with the reaction, so the person is the one who's done the ayn or the hasad, or Allah gives you. You're reading for one particular person, Mr. A, and the person doesn't see that, he sees an image of Mr. B. So then you leave off Mr. A and go for Mr. B, you see. And when you're doing that ruqya for Mr. B, you might see Mr. B again. He might see an image of Mr. B again. That's fine. That's positive result. It's Mr. B who's done the sihr. Or you might get him this time. You might not see any visions, but you might get body shake. Okay, it's still Mr. B. That's the reaction we're looking for. We're looking for a reaction from Mr. B. You see, or yeah, like I said, or you might see the image of Mr. B again. You see, So when I did this diagnosis here for these 3 people, who he saw when I did, Allah show us if all of the ayn is from humans. He saw 3 people. When I did the diagnosis, again, okay, show us if all of the ayn is just from these 3 people, meaning nobody else. It's only from these 3 people. And it's important for you to use this just and only, these words, when you're doing it. So you restrict it to those 3 people. So I restricted the ayn. Allah shows if all of the ayn that this brother has is only from these 3 people. And then his body started shaking. So I said, okay, alhamdulillah, it's only these 3 people. So I didn't need to look for anybody else. And alhamdulillah, also no visions. You see, no visions this time as well. But previously he had a vision of those 3 people. So Allah will help you, subhanahu wa ta'ala. Subhanahu wa ta'ala will help you when you do this diagnosis to work out what's going on, you see. Yeah, so then we did the diagnosis. Allah show us if we've extracted all of the important info from this brother's spiritual diseases. Then he got a reaction, alhamdulillah. Tayyib. That's that case. There's one more here. We'll do one more. So I was dealing with this case. So the brother. So what happened with the brother? I read Ruqya. I want to show us if this brother has anything that reacts to Ruqya. So that's what I did first, because I was unsure. They didn't know what they were suffering from. So I said, okay, time was limited. So I was only going to do one diagnosis on them. And what it was, after speaking to the brother and his wife, it looked like they had been missing prayers. He started trimming his beard. He started doing this, fall into some sort of sins, not praying on time. So they'll pray, one day they'll pray 4 prayers, the next day they'll pray 3, next day they'll pray 5. So it's all messed up. So basically I said, look, we can't do much in this what's its name session because of the sins, you see. So what we would do in this session, I want you to go away, make tawbah. I told him what to do, play Salatul Tawbah, ask Allah to forgive for all those sins you mentioned. You're not going to be doing any of those sins again, listening to music and things like this. It was so they agreed to all of that, and they're going to be praying on time and that. After they spent some time doing that, doing their prayers and that, they came within the same sort of session. We came back and said, okay, we're only going to do one Ruqya diagnosis. So you got them to get their reference point, and I just read Allah shows if they have anything that reacts to Ruqya. And this might be actually the diagnosis that maybe everybody should do. I mean, that's the one I do now anyway. When I'm checking myself, if I get some crazy waswas or anything, feel a bit different, I do, Allah show me if I have anything that reacts to Ruqya. That's a spiritual disease. And did that yesterday, I think the day before, maybe even. No reactions now, alhamdulillah, because I'm cured, alhamdulillah. But that's what I did with this brother. Just do anything, and that's what maybe you should start with your diagnosis with. I mean, that's somewhere where you can start, so you definitely know there is something here. We're just gonna have to work out what it is. So you do, I want to show us if there's anything that reacts to Ruqya diagnosis, and you read with that intention. You see, so that's what I did with this brother. So they reacted, and what they saw was visions. They saw visions of, it seemed like maybe a river and sea, or they saw blue, and one of them saw blue color, and everyone seemed to have seen. They saw like a river, and it could be the sea, basically. So the following session, I did a proper diagnosis on them because of the Tawbah they've done, and we definitely know that there is something there. Now we just had to work out what exactly it was. You see, or the things which were important to know. What Allah wants them to know, because sometimes you won't be doing all of the diagnosis. You're not going to find out all of the spiritual diseases you're suffering from, and that's not necessary. Alhamdulillah, what we noticed, we don't need to find out about everything. There are certain diseases you need to know about. Allah wants you to know about those things, so you don't need to know about everything. Okay, so we did here sihr. Is it for any humans, jinn or humans or both? And he reacted. Is all of the sihr from human sahirs? He reacted. Allah show us if all the sihr is from human sahirs. He reacted. Or Allah show us if all of this sihr is from only one human sahir, and he reacted again. Okay. Then I did. Is all of this? Allah show us if all of this sihr is from a human that the brother recognizes if he saw the sahir's face, if he saw his face, and he reacted to that as well. So we know that, okay, he recognized it. Then I started speaking to them. I say, what do you think? Who do you think you could be? Then he said, okay, I've got an uncle and the uncle's wife. It could be these people. I said, okay. All right. So I read with intention. I want to show us if it's any of these two who are the sahirs, is the sahir. And he had a reaction, but but what he saw was again a face. He saw a face, and he saw a face of a cousin. And he said he was a bit surprised. So I saw the cousin. I said, okay. I said, I've had that problem before. I'm reading for two other people, and you see somebody completely different. I said, okay. So I ignored the reading for the uncle and uncle's wife, and then I read for this person. Let me just read for this person. And I read for this person. And then what it was, he saw that person's face again. And I said, okay, there you go. It's this person, brother. This is the person who's done the sihr on you. It's this person. And he accepted it because he said, yes, I've had some problems with this person. I'm not surprised that he did it on me, you see. Yeah. Then I checked him for Kabal sihr. He reacted. Is all of the Kabal sihr from human sahirs? He reacted. Is all of the Kabal sihr from only one human sahir? He reacted. Is all of the Kabal sihr from the one who gave him the sihr, conventional sihr? And he reacted. He reacted to that as well, you know. And then he had some issues. Things were disappearing. The reason they contacted me was because they were losing. Things were disappearing from the house. Shaver, scissors, and things like this. And when they told me this story, I was thinking maybe the Sahid is sending jinn to get these things because they got their hair on, the brother's hair was on there, so you take it and do sihr on him. So then I did the diagnosis to Allah show us if the sihr or the Kabal sihr or both, because I don't know which one it is. So, but just to make the diagnosis easy, because it doesn't really matter which one it is. It doesn't matter if it's both, if it's one or one of them. It doesn't really matter. Or Allah shows if the Kabal sihr or the sihr or both of them are causing the things to disappear from his home, the things he was complaining about, which were disappearing, and he reacted to that. So he was happy with that because he didn't know what was happening. Why these items keep missing, brother? I'm losing these items, shavers and things like this. So he understood that. Alhamdulillah, he was happy with that result. And then he had some issues. Got issues with his wife, and he just wanted to know the problems I got. Do you think these marital problems I've got, is it because of the sihr and Kabbalah sihr? And I said, okay, let's just check, brother. So I did again. Well, it shows if these problems he described. Now, what I went by there is his definition of that, and that's why it's important to know about definitions here when you're doing things like this. So he's described some problems to me. I don't exactly know what all these problems are. So I'm not going by my definition of what marital problems are. I'll say, okay, I'm going by what you've described. I want to show us if these problems he's describing, the things he knows about, Okay, is it being caused, what he complained about, is it being caused by the sihr or the kabal sihr or both? And he had a reaction to that. So, and then that's what I said to him. I said, brother, you reacted to it. It means what you were telling me about that thing you were describing. You didn't obviously, he didn't give me all the full details, but he told me some of the marital problems he had. I said, those things you're talking about, whatever you meant by marital problems, it is being caused by the sihr or the kabbalah sihr or both of them. And like I said, it doesn't really matter which one it is really. He just wanted to know an answer really. Then we did extracted all the info, and he reacted to that. Alhamdulillah, because I felt that was quite comprehensive, so I just did it. I mean, I as you can see, I didn't check for ain, and I didn't check for hasad. I didn't even check for hasad, but because I thought that information was enough, I just said, okay, let's see if you're ready, brother. And alhamdulillah, he reacted. He was okay. He was ready for it. You see. طيب. I think we'll leave it here. Yeah, that's basically how you would do a diagnosis, inshallah ta'ala, a thorough diagnosis. Just to reiterate that point, the point where when you've got to make sure you restrict when you work at somebody's got sihr or something, and you want to work out is all of the ain from one person, you must use the words just and only, restrict things, don't make things too general. You want to restrict it so you know that the reactions you are getting is only for something specific or a specific person, or all of the ain is from this person, it's not from anybody else, you see. So طيب, okay, we'll leave it there. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت نستغفرك ونتوب إليك.